Good morning, everybody. Welcome to the Children, Young People and Families Cabinet Panel for Hertfordshire County Council. I'm County Councillor Teresa Heritage. I'm the lead member for Children, Young People and Families, and I'm chairing the meeting today. Before we start the actual meeting, I have a few announcements to make. First of all, due to COVID-19, due to the coronavirus pandemic, the Council will be holding this meeting electronically in accordance with the relevant regulations. Members of the public may also attend this meeting in an electronic capacity, and there is a link on the Council's website for them to do so. Members of the Council are asked to keep their microphones switched off until called to speak, and to switch their microphones off once they have finished speaking. Cameras may be left on throughout the meeting if members wish. If you experience connection or other technical issues, it may help to switch your camera off. Cameras should be switched on if and when speaking in the meeting. To indicate a wish to speak, members should use the raise hand function. Use of the meeting chat function is exclusively for voting. At the end of the debate on each item of business, there will be a vote. Members should vote using the meeting chat function by indicating for, against and abstain. And Anthony might be telling us his vote in case things go wrong for him. I will declare the result after each vote. Breaks of at least 15 minutes will be held every 2 hours and will be taken after a speaker in the debate has finished speaking. If we are voting, the vote will be concluded before the break is taken. Our breaks will be incorporated as appropriate. Now, can I just remind members, I'm sure I don't have to remind members, but today is Armistice Day, and we will have a 2-minute silence at 11 AM. But I will ask colleagues to remain in the meeting and on screen during that time. And at the end of the 2 minutes, I'm going to have my alarm go off, hopefully, just before 11 to remind me. But at the end of the 2 minutes, officers will indicate and we'll carry straight on with the meeting. We have one withdrawn item for this agenda. That was item 6, recommissioning of overnight short break services. This will come to a later meeting. And I now have another announcement something to say. So I'd like to say thank you to many families for writing to members about the survey distributed in Hertfordshire for families with SEND children by the National Scnd Crisis Group. We are grateful to families for sharing the findings of the service and will use the results to help inform our work. However, this is only a very small sample of families, 170 out of nearly 9,000 families in the county with children and young people with SEND. Obviously, the output from the survey is not news to us. Our SEND officers have been working really hard for many years to improve the experience of families. We acknowledge that more needs to be done, but this is not about individual SEN officers' commitment, but to the SEND system, both in Hertfordshire and nationally. Can I take this opportunity to thank the terrific SEND teams across the council. This administration takes SEND very seriously. Jo Fisher and her team have been working for many months on a plan for bolstering the service. Her robust plan has meant recently the SEND service has been allocated an additional 1.5 million for resourcing and changing the way we work in this financial year. There will be further investment over the next few years coming out of the IP process. We have a plan to get back on track, and our Scnd strategy up for discussion later on hopefully reflects this. I have an ambition for this authority to be one of the best performing councils for SEND in the country. I hope that members and families will support us on this journey so that some of our most complex and vulnerable children have the best life outcomes that we can give them. Officers will say more on this when we come to the Children and Young People plan. So thank you, colleagues. Now on with the formal business. Membership changes. We have Calvin Horner, Councillor Calvin Horner, substituting for Helen Campbell for this meeting only. And we have apologies, obviously, from Helen. Members at the meeting today are Nigel Bell for Labour, Leslie Greensmythe, Dee Hart, Paula Hiscox, Graham Lawrence, Mark Mills Bishop, and Fiona Thompson from the Conservative Group, Calvin Horner, Anthony Rowlands, and Mark Watkin from the Lib Dem Group. I don't think I've missed anybody out. Just shout if I have. Members' interests. Can I remind members to disclose pecuniary interests and anything that's declarable, even if it crops up at the meeting? So the first main item on the agenda is to confirm the minutes of the meeting held on 16th of September 2021. Does anybody have any questions? If not, can I ask Joe just to cover off actions, please?
Absolutely, Terry. Sorry, I was just trying to unmute myself.
Sorry, and I should say Joe Fisher is our new Director of Children's Services. Sorry. Thank you
very much, Terry. Yes, so on the minutes, there were a number of actions. One of which related to us circulating a briefing note on NIAS, so the support that we commissioned from the National Youth Advocacy Service. That note was indeed commissioned. We're happy to take any questions on it, but I hope that it gave a really clear overview of the level of advocacy that we commission for all our children with a social worker in Hertfordshire, including an independent visitor service. Secondly, there are a number of actions grouped together in the minutes around information around SEND, which related to the caseloads of our staff with SEND, the outcomes for children with SEND, and the level of demand we're seeing across the system. I have agreed that we will bring a report to February's panel that covers all of those points. I hope members are okay with that. It does make sense to bring it alongside our broader Children's Services performance report that's due then. And I think it will give a sort of comprehensive overview. And within that report, we will also provide the update on our SEND review that was noted in the last meeting, which is really looking at how can we enable our frontline SEND teams to work effectively to meet the needs of children and young people. And that references the Chair's, Councillor Heritage's comments on the 1.5 million investment, which we will be using to really build the resilience and the capacity of our frontline SEND teams to provide the best possible service for our children and young people with SEND. Chair, I think that covers off all of the action points, unless I've missed any.
Okay, thank you very much, Joe. Does anybody have any comments on the meeting, on the minutes itself? No, in that case, we'll go into to vote. Can I ask colleagues to approve or not the minutes, please? Thank you. And that's in chat. Have we all voted? Yeah, okay, lovely. Thank you very much indeed. So item 2 is public petitions. We have none. And so we move on to the first substantive item on the agenda. Our way forward, the plan for children and young people 2021 to 2026. And we're going to receive a presentation from Hannah Bolger, who is the Performance and Development Manager for Children's Services. So Hannah, over to you. Thank you.
Thank you. And can I just check quickly, Joe, did you want to say anything before I start?
Hannah, just very briefly to introduce, I mean, Hannah's going to present to you our 5-year plan for children and young people. We're asking panel to note the recommendations to note the priorities set out in the plan and to recommend approval to Cabinet. We've had discussions at panel previously on this plan. We think it provides a really ambitious and concrete way of really making a difference to the lives of all of the children, young people and families in Hertfordshire, and we welcome your comments and support. Thank you, Hannah.
Thank you. So I will just share the presentation. So yes, as Joe explained, I will be talking through the plan for children and young people 2021 to 26. It's also accompanied within the papers by the strategic priorities for 2021 to 22. It's worth noting that this has already been discussed at the Education, Libraries and Lifelong Learning Cabinet panel as well. So just to give a brief overview of the background of how we've got to where we are today. We started back in November 2020 with engagement with children's services staff and managers, children, young people and families to identify what they felt would be important for children, young people and families over the coming years. We then put together from that a first draft of the plan, which then went back to those same groups for engagement and feedback. From that feedback, we obviously made some changes and it was really good. At that stage, the feedback was really, really positive, but there were a few little things that we could pick up on and make some changes for. And then since then, it's sort of been progressing through the children's services and political sign-off processes. A slight change to in the paper, it was noted that the plan would be published in November. However, because of a couple of changes and the need to align, well, the desire to align with the Scnd Strategy publication as well, we'll actually be publishing in January. One other thing which I really wanted to highlight was the introduction of the Be Included outcome. So this is an addition to Children's Services' existing outcomes framework. And it's really just to showcase and highlight the importance of the children, young people and families that we work with being and feeling included in the work that we do and having their voices heard. So the implementation and further design of this outcome has been overseen by the Children's Services Diversity and Inclusion Board, and it will launch alongside the plan and priorities in January. You will have all seen the plan itself within the papers for today's meeting, but I just wanted to focus particularly on the ambitions, which I suppose are sort of the core of the plan itself. I won't run through them in detail, but obviously we have the 5 ambitions to cover all of the areas across children's services. And one addition that I wanted to add to the paper as well was more information on the reporting proposals for the plan and the priorities. So we'll be producing an annual update on progress against the strategic priorities. And obviously the strategic priorities are an annual document. So at the end of that year, we'll be reporting on the progress. And there'll be sort of form 2 parts. So the first will be an update, sort of a narrative update on progress against the strategic priorities, but also accompanied by performance data on identified KPIs. And this will be, we've already had mention of the normal reporting processes to this cabinet panel, and this will be in addition to that, focusing specifically on the strategic priorities. So in terms of the identified KPIs, you will have seen within the plan itself, we have some measures of success, and the KPIs have been identified from that. I won't run through these in detail, but I'll leave them there for you for a minute so you can have a look. And yeah, like I said, they've all been drawn from the measures of success within the plan itself. So that was the brief overview that I was going to present to you. I can leave this up for another few minutes to give you a chance to have a look, and then perhaps open up to any questions. Terry, you're on mute.
Like I'm always good, but then I forget to take it off. Thanks very much, Hannah. Just a few comments from me. I was at an LGA SEND webinar yesterday, and I was really pleased to see that Dame Christine Lenehan from the Disabled Children's Charity actually used our Outcompanied as a good example of best practice. So it was up there. Obviously, it didn't have to be included there yet, but that was there. So well done for developing that. Performance data is really, really important, and as Hannah has highlighted, we will continue to get our quarterly updates on data, which we do across always at meetings, but this will be for this particular plan. There will be annual update, and we will look at a trend potentially. I think, and I know Hannah's talking to Paul Dryden about how we can best do this. So I'm really, really hopeful for this. So thank you very much, Hannah, for your hard work. So we'll now move on to questions. The first hand I saw go up was Mark Watkin, actually. Sorry, Mark Mills Bishop. Oh, then Mark Watkin. Then Nigel Bell. Sorry, and then Paula.
Too many marks. Thank you. Thank you. Good morning to everybody. Thank you, Hannah, for your report. I should declare an interest in my members register of my wife and son being teachers in Hertfordshire. Hannah, thank you for your report. Can you just give a bit more information as to how young people were consulted and the input that they had in framing, if you like, your report? How wide and extensive were young people involved? That was my question. Thank you, Chair.
I'll stop sharing that now. I can obviously put it back up again at any point if people want to be reminded of it. So from the outset for us, it was really important that children, young people and families were a really core part of developing this. So from the outset, we put together an engagement proposal, and that proposal was very much based on getting good interactive engagement with children, young people and families. So the engagement that we did was through focus group style engagement, which means that the numbers that we consulted with were not as high as if we'd done a big survey, but we felt it was really important to be able to have conversations and to be able to pick up on things that were raised. So in the initial set of engagement, I included some of the brief overview of the questions that we asked. So we asked what they felt would be important, how the council could support with this, and then we also picked up on some themes from the previous plan that we wondered, what their thoughts were, should we continue, and we took those questions to different groups of young people. So we spoke with a number of the youth councils. I haven't got all the list in front of me, but we spoke to a number of the youth councils, and I'm just trying to think. We certainly over the course we spoke to the Children in Care Council. We also spoke with Hearts Parent Carer Involvement, so parents and families of children with special educational needs, and we also have a families panel within Hertfordshire Children's Services who we consulted, and we also spoke with foster carers. Okay. And again, the focus being that they were a core part of that, we did all of those engagements at the same time that we were also speaking to Children's Services staff, so that we could bring all of that information together to inform the plan itself. so that it was really presented together and sort of on a level pegging. So we did that initial engagement, which was then taken to our Children's Services Core Board for the first sort of drafting of the plan. Once that had been done, we then went back to those same groups to have similar, the same sort of format of conversation about how they felt, whether the plan reflected what they thought they'd fed in. And like I said previously, the feedback was really positive, not only around how the plan looked, but that it was reflective of the messages that they'd given us the first time round. And again, even at that second stage as well, we were even talking to them about, how would they want to engage with the plan? Is it something that they would want to engage with over the course of its lifespan? And from that's really informed the communication strategy that we're launching. So they've been sort of thinking about what they've been telling us has been at the heart of not only sort of the content of the plan, but how we talk about it. And actually, even the reporting proposals, we had comments from the focus groups that people wanted to know, it was all right saying this, but how are we going to report on it? And that informed some of the text that we included in the plan about it being presented to this meeting, the reporting.
Now, I'm pleased that their voices were heard. I think it's very important that they were heard. And I'm also pleased by what you said in the robustness, if you like, of their involvement. And that is very important. And it's been taken on board. And we've heard from the chair in relation to the LGA workshop plaudits that were given out. So well done. Thank you very much indeed for that. And thank you, Chair, for allowing that second point.
Thank you, Hannah. Can we go Mark Watkin, please?
Thank you very much, Terry. And you can never have too many marks, by the way. We're a privileged group. Yes, the strategy is absolutely what it should be. It's got lots of good content, lots of strong directions. I thoroughly like the idea that it's looking to integrate with other services. And it's about trying to meet needs locally. I mean, one could go through it in detail, but we have a very busy agenda. I think it's fair to say that in its overarching ambition and intent, it's what we would like to see, and we welcome it. I think Hannah made a good point, and it's come up in the KPIs that people have raised this question of how do we actually hold you to account? How do you measure the outcomes? Good intentions are one thing, delivery is the big issue at stake. So I welcome those KPIs. However, I only looked at them very quickly, Hannah. What I didn't see was anything about KPIs to do with staff retention, staff workloads, the sort of things that actually are underpinning the statement that Terry made earlier on about the special needs team having to try and deliver a service. And I really think we need to know more about how how that's going, because one of the key points in it is that the staff should feel fully staffed service and should be proud to work for Hertfordshire County Council. But we've got no way of knowing the standard things. Any organisation, you look to see what the sickness figures are like, what the staff turnover are like, and that's a very indicative set of stats, which gives you a feel for whether people are comfortable and happy in the work they're doing. So I would press to have something along those lines added into the KPIs. The only other comment, and I'd like to hold it back until we finish the main substantive discussion on the document, is the sustainability statement, which frankly I have got concerns with, but I think it's a diversion to dive into that while we're talking about the core policy. But if you allow me the opportunity to come back later with some comments about sustainability, I'd like to do so. But yes, our group will be supporting it, subject to well, not subject to anything. We're going to report it whatever happens, but we're looking to see good feedback on how the objectives are met. Thank you.
Hannah, can you respond to the staff matter KPI, or do I bring Jo in? You're okay with that? Yep.
Yeah, I can add something quickly, because I'll just reshare these, because it's probably because they were the last few, but there are already some KPIs in here relating to HR. So we've got the percentage of voluntary turnover, average of all days lost, which relates to the comment around sick days, and we also have some additional measures related to diversity and inclusion, so our workforce diversity and inclusion strategy, and so we are covering that, and we've also had some good conversations looking at what measures we can pull out around sort of the staff satisfaction side of things, like you were saying, feeling proud to work in Hertfordshire. These are, I suppose, the more developing side of things, because it's not things that we ourselves have historically reported on. So it's developing, but I think we're looking to see where we can strengthen this area of things as well.
Yeah. Okay. So Matt Ansell, did you want to come in on that?
Thanks, Chair. Just really briefly, just to follow up on what Hannah said. So we've had a very good strategic workforce plan in place that has the 3-year cycle's just finished. We're just in the process of going back to staff to talk about that and what they see as our priorities and the needs of the staff for our workforce strategy. And that work's happening at the moment. And then the group that leads the workforce strategy and the work streams will be meeting again in mid-December to sort of start picking up that feedback and looking at how that informs the next 3-year strategy. And then the points around diversity and inclusion, we're also actively involved in the RES, which is the Workforce Race and Equality survey, which is a national survey in Hertfordshire, very much involved in that, looking at how we meet the needs of our sort of diverse and inclusive workforce. And I sort of really sort of agree with Mark's comments. You know, the sort of emotional well-being, support and retention of our staff is integral to the delivery of services, and certainly Joe and I and Marion are fully aware of that, and that's why that workforce strategy is a really important piece of work for us sort of moving forward.
Okay, okay, is that all right, Mark?
Well, can I just come back on one comment, if I may, Terry? Yes, I find what's been said so far is very good. Thank you very much. But staff workloads, I think we're going to come back to this with the Scnd Strategy, but and also, may I say, who's included in the figures that we see, because it turned out we did not have data being given to us about the Scnd officers because they're not social workers, and yet they're key deliverers of our service. So, but the main point I want to say was staff workloads. We need to have some idea as to what they should be doing and what they're actually being asked to do, because that's okay, thank you.
That's all. I think we are dealing with all that, and that's all coming, isn't it, Joe or Matt? At some stage.
Yeah, very, very much, Mark. We have all that data, and we have a sort of quarterly report to our core board around the whole of the workforce and children's services, and we can certainly bring that work to the cabinet and share that in terms of what we're doing, but also the data that sits behind it. And we do look at all staff across the system, not just social workers. So we're very, very carefully monitoring retention, recruitment and vacancy rates across all parts of children's services.
Yeah, Joe?
No, absolutely. I think Matt said it all, Chair. That's fine.
Okay, thanks. Yeah, we are going to change. I'm keen to see more in our quarterly children's performance reporting, so I'm trying to get more lines in there, not just social care, so you can see a fuller picture of the whole service. I've been trying for years, but hopefully we'll get there. So yeah, everybody's on board with that. So hope that's okay. Thank you. Nigel.
Thank you, Chair. And yes, overall, I also welcome the report. I mean, one can't disagree with much of what's in there, and we've obviously had we've had this before in the lead up to this. But I'm pleased. The first thing I was going to say, though, I'm pleased Matt has mentioned, obviously on page 39, the WRES, the Diversity Inclusion Programme, including the Workforce Race Equality Standards. I'm pleased to see that highlighted, and obviously honour our commitment to listening and responding to the voices of children again, young people, and obviously the Workforce Race Equality Standards. So that's all good. And on that same page, talking about becoming a centre of excellence, professional development, including leadership. So again, looking at how staff can progress. But again, obviously taking on Mark's point about, we'll talk about later on, workforce and the social workers. I think we need to talk about, obviously we'll talk about that later on. But I also want to note on Appendix C, where we page 41 down the bottom, in relation to Councillor Mills Bishop's point, when it said on the left, you know, we listened to what you said, and it said children, young people and families are unlikely to read this document. Social media should be used to communicate messages. And okay, you then say focus groups have been planned to identify a way to communicate key messages on children, young people and families. And I know you do list at the bottom there the different youth councils, Watford Youth Council, North Herts Youth Council, etc., and CHIC. So I'm assuming then that in future the emphasis will be, you know, a lot more on social media and communicating to young people and many young families in the way they normally do. And again, recognising Scnd the fact that often families and parents, you know, maybe email, but other ways is the key way they communicate. But I don't know if you can comment on that. But overall, yes, of course, I support the board overarching ambitions for this. And again, I'm pleased that building life chances obviously is in there. So, you know, overall, I welcome it. Thank you.
Thanks, Nigel. Hannah, do you want to comment on platforms that we're going to be communicating on? I know Joe's been having a conversation very, very recently about some of this, but do you want to comment, or shall I bring somebody else in?
I can briefly cover the communications sort of plan for the plan specifically, and then Joe may be able to comment sort of wider. So yes, the communications plan for children, young people and families is very much focused on social media, and one of the differences that we're doing this time as opposed to previously, the communications have very much been focused on that the plan has been published and that it is available, and that's what we really picked up that was not necessarily going to be the particular area of interest for children, young people and families. So the communications that we're planning on doing will be very much trying to bring the plan to life a little bit more. So we've got 5 days of activity planned to align with the 5 ambitions. So on each day, we're going to be focusing on one ambition and how that really relates to the practical things that children's services do, services that that children, young people and families can access, and that will all be through social media. So we're already sort of deep in conversations with our comms team about how that will work. But it's really trying to separate out the areas of interest, maintaining the sort of the professionals' interest in the plan itself, but also then really picking out what can be of interest to our children, young people and families.
Okay, thanks, Hannah. So are we saying that it's going to look a bit like how our fostering team does their social media? It's very sort of interactive with families, etc. So it does bring it to life.
Yeah, absolutely. We're looking to identify sort of case studies, or we're like picking out particular stats that might be of interest. But yes, lots of pictures and lots of interesting things that will draw people's attention on social media.
Okay, thanks. So it's a bit of a plug then for to members and anybody that's listening to sign up for the County Council's Facebook pages and Instagram. So there we go. That's my advertising for the day. Paula.
Thank you, Chair. A really good report, Hannah. As a new member, I really welcome this. And good to see at 4.2 that for our staff intranet, we're going to have an online library with the full range of children's services, and that would be really helpful if I need things for residents to go into. And I'm really good to see the key performance indicators, that we're going to be tracking this and it's coming back annually, because as a new member, I don't have any real measures on it. So that is going to be really useful to have those key performance indicators tracked. And so thank you very much.
Thank you. Thanks, Paula. I believe, you can tell me if I'm wrong, Hannah, that you've got your sort of core team meeting next week or in the next couple of weeks to sort out some baseline numbers. Is that right?
Yeah. So we're in ongoing discussions about what baseline we use. As I mentioned earlier, some of these measures, some of the KPIs are sort of new for us. So some of them where we've been collecting the data for a long time will have a really good baseline, really good historic data that we can use as a baseline. Others we will it's potential that we'll sort of need to use the first data point as the baseline, but that we can track that as it changes over the course of the plan.
Lovely, thank you. Great. So I've got Anthony and then Calvin. Anthony.
Teresa, thank you. I'm afraid my camera's being uncooperative, but I'll speak. Thank you to Hannah. I thought her presentation was exemplary in its clarity. Two questions. One, a couple of references to the work that's going to be done by officers on the KPIs. Maybe we can have that explained to us in terms of what steps have been taken when we get Paul Dryden's report at the next meeting. I think that'd be useful so that we can connect up these things. And the second one, I know Mark is going to come in with a further thought on this, but if I may, while I'm speaking, just comment on the sustainability assessment, which is incredibly important, and I guess children are amongst the most powerful voices here. And when I did look down the list that's on page 45, 46, it is a bit underwhelming, I have to say. And I'm remembering back one of the sort of mantras that used to be around, I'm not sure whether it's still around, was MEC, ghastly acronym, make every contact count. And I'm just wondering what we do to engage. We've talked about the children's voice being heard. There surely must be opportunities to engage with children and to hear what they expect this service to be doing, as well as to be engaging with a host of other people we have contact with as in an individual capacity, supporting services that are provided, but also I'm thinking about partner agencies that we have contracts with and what expectations we place on them. And I just find the table in the agenda is really very thin, but maybe you want to respond to that when Mark's also said his bit. Thank you very much indeed, Teresa.
Thank you. Okay, if we may, Anthony, we'll come back to sustainability after the Appendix E after. We've had this discussion. Great, thank you. Calvin.
Yes, thank you, Chair. I would like to join with the comments thanking Hannah for the presentation. I think it was very clear and very useful for a substituting member who's sort of picking up these things first time. And I certainly welcome the ambitions of the plan and what's in it. The one thing that I wanted to pick up was on page 40. There were some comments about children with experience serious violence or involved in serious violence, and I appreciate the comments about prevention and intelligence. I wondered whether, and it may be something that's been dealt with at an earlier meeting, so apologies if that's the case, but what was being done around safeguarding and supporting those children that are in situations where they are experiencing that violence themselves, or domestic situations where they're experiencing such violence.
Thanks, Hannah. Okay, do you want to respond, or Joe?
Hannah, would you like me to pick up on the detail of that? Thank you. Calvin, thank you very much for your question, a really important question. And Matt's on the call too, and he might want to make some comments. Just very briefly, the serious violence strategy for Hertfordshire, we've reported on aspects of that relate to children and young people in quite a lot of depth at previous panels, and actually I'm very happy to bring forward a future report updating on our continued work to put prevention first, right at the heart of our work with children and young people who may be exposing both themselves and others to risk through becoming involved in serious violence. It's certainly something that's right at the forefront of our work. We had an inspection, a focus visit by Ofsted in July of this year that looked at the risks that young people engage in outside of the family home, so extrafamilial harm, which looks at things like modern day slavery, county lines, gangs, involvement in a drug culture, those sorts of things. And indeed, what the inspectorate told us is that we have both a very strong practitioner and frontline response to that, but also a really strong multi-agency support structure in place across police, health, schools and the council, as well as the voluntary sector and districts. That really means that we have a robust response in place. However, we recognise there's always more we can do, and we are refreshing our plan around what are we going to focus on for the next couple of years. So I'm very happy for that to come back for a discussion at some other time. And I think it's an important issue you raise. Matt did put his camera on, so I just want to see if he wanted to add to that or whether I've covered it.
Yeah, Joe, you've covered the points I was going to say. The only other bit was to say that Joe's referenced the inspection that took place in Children's Services, and our colleagues in police also were inspected in July time. And again, sort of part of their inspection around their safeguarding was around extrafamiliar abuse, how the police are set up to sort of meet the needs of the community and children and young people. And again, they received really strong feedback about the partnership work that goes on between Children's Services and police in Hertfordshire, and how we are able to respond to, but also sort of have a preventative approach to understanding the pockets of needs in the county and where the areas of concern are, so we can actively, in a preventative way, support children and young people.
Okay, thank you, Matt. Marion, did you want to come in?
Sorry, I wondered whether you wanted me to comment on sustainability and the work that we're doing on sustainability.
Okay, right, hang on a second, I'll come back to you in a minute. So yeah. Are you okay with that response, Calvin? All right?
Yes, thank you. Yeah, I'm pleased to hear that of the work, all the work that has gone on and is going on, and look forward, although I may not be on the panel at the time, but look forward to that future report, because it is a very important area. So thank you.
Yeah, thank you. Obviously, any member can read our panel papers. They're really great reading and very important reading for members, actually. Okay, so then we've got on to the question about sustainability. So Mark Watkin, do you want to ask your question or make your comment?
Yes, if you don't mind, Terry, thank you very much. And it's fair to say that these comments are largely geared to the education element, but there's also a little piece about the sort of work of the particularly the social worker team. I mean, the comments that I'm getting from my colleagues who are more expert on sustainability says they should be highlighting that since it's probably one of the largest potentially avoidable carbon impacts of the children's services affecting, after decarbonisation of school buildings, this is about reducing the environmental footprint of journeys for children in placements and those attending special schools. You know, are we thinking about how the journeys to and from those schools can be reduced? There ought to be a commitment to ensuring that school places and other services for children are accessible by sustainable transport, and increasing the proportion of these that are within walking or cycling distance of the children's and young people's homes. There should also be a commitment to delivering services in ways which reduce the need to travel by staff or clients as far as possible. It would be good to see if there was a recognition both of the impact of air quality on schools and other services, and the impact that users of the facilities can have on this, which is mainly about vehicles idling, etc., etc. Those are the kind of comments that have been fed back to me by my colleagues. It's really, we think that the focus on the report is just too narrow as it stands, and it ought to be here, because if it isn't here, where else will it appear? Thank you.
Okay, so I'll just start by making a comment, if I might. You started off your comments, Mark, by saying this is really for education, correct? This is for education. So the comments you're making are around schools, and I agree that our service, this particular panel, does do schools, as it were, as well, especially for SEND, but so we need to bear that in mind. As you know, we are doing a lot of work around trying to reduce travelling for young people with SEND. We are trying to bring facilities and build facilities in more local areas. So just we are doing these things. It just sounded a bit by your colleagues' comments that they didn't know that. However, who am I going to bring in first, Jo or Marion?
I'll let Marion talk first, and then if there's any further points to make, I'll pick them up then.
Okay, thank you.
Is that
Marion?
Okay? Yeah, go on,
Yep.
Marion.
So in terms of the broader children's service and sustainability, we have met with corporate sustainability team, and we've set up a number of different work streams. And yes, the work hasn't been included in this sustainability impact assessment, and perhaps we should have been better joined up. But we have a work stream with our children's homes where we're looking at how the buildings can be made more sustainable, looking at things like recycling, looking at how we include children and young people in the sustainability conversation, because we know that sustainability and climate change is very important to them. So there's a big work stream happening in the children's homes. There's another work stream happening in the fostering service where we're looking with foster carers at how sustainable their homes are, at how they're working with children, because what we do know is that sustainability is really important to our children, and it is the children who will make a difference to the world. So we're doing a lot of work with the fostering service. We've also got a work stream that's looking at staffing, so looking at staff travel, looking at the use of paper, those sorts of things. So across the service, we do have a big schools work stream. As Teresa's already mentioned, it is it's well established. It's the best established piece of work that we have within children's services at the moment. But I would like to reassure you that right across services for young people, we're also linking them in with the corporate support. So it is something that is becoming of higher priority across children's services. And there are no parts of the service really that aren't engaged with the conversation at the moment. And we do have a children's services action plan. We've got sustainability champions. And yeah, it's a piece of work that we are doing.
Yeah, so I think the problem here is, and I appreciate colleagues' comments, is that there's a template, and the template's been responded to with the comments. So I think we need to just go away and think about how, as a service, how we go away and fill out these assessments. It's still new to us, and how much we put into it. In the meantime, I think it would be really, really useful if a report could be circulated to members of this panel about what we're doing in the sustainable arena, because there's a lot going on. We know that, and I'm sure it is in one place, and I'm sure we could share that. So can we do that, Marion?
Yes, we can.
Yeah. Okay. So colleagues, rather than lengthen the conversation around sustainability here, I hope you'll accept that something will be sent to you and hopefully reassure you, and then we can bring it back potentially at a panel. Mark.
Well, if I can, I know you want to close this, Terry, so I'll keep this very brief. I think the comparison between the impact assessments that we get, which are very detailed and remarkably clear in what they're saying, and this very brief summary is, I think, very marked. And I think we'd be looking for something that's so critically important to the way this council will work. We would like to see something much more thorough.
No, I hear that, Mark, and that's what I'm.
Yeah, I know you do, Terry, but I just wanted to draw the comparison that one side.
No, but you must remember this is not the Environment Committee. This is Children's, Schools and Families.
No, I suspect this may be true of other directorates as well. I suspect this is a generic thing in the authority. Yeah. I'm just using this panel to make the point, but I suspect other panels may be having the same challenge.
Excuse me. Yes, indeed. So that's what we'll do. Is that all right? Anthony, is that an old hand?
No, it's a new hand, and I thank you for that initiative. And I think that's really important. And I hope that the report will also embrace a response to particularly to the point that Mark made earlier about travel to and from. Thank you very much.
Oh, great. Sorry, just about to choke. Thank you very much. OK, so the recommendation is that the Children, Young People and Families Cabinet Panel note and comment upon the content of our way forward and the strategic priorities and recommend adoption for them to Cabinet. Please, could you vote in the chat box? OK, that's approved. Thank you very much, colleagues. Good conversation. Thank you very much, Hannah. Thank you for your attendance. I hope you've got a lot from that. So,
thank you. Thank you all for your comments and questions.
Thank you. So now we move on to the Scnd strategy for 2022-2025. We have Danny Bailey, Business Support Manager for Scnd Transformation, presenting, supported by our new interim AD on, I can't remember the whole title anyway, Tony Fitzpatrick, who I'm sure you all know. Tony's sort of stepped up since Joe took over as DCS. So Tony is now our Scnd man, and inclusion. So Danny.
And morning, everybody. Tony's going to start off just to explain sort of like the outline of the strategy, and then I'm here to talk through the engagement, as that was the request from the last panel.
Thank you.
Okay. Thank you very much, Danny. I'd just like to say thank you to Danny.
Can you move closer to your microphone,
yeah, sorry.
Tony?
I always think I look a bit odd leaning into my laptop. I do need to get this fixed, but hopefully that's a bit better.
Yes, so thank you.
Just wanted to say that Danny's done an awful lot of work on this, so she'll be aiding me with any of your questions afterwards as well, because I'm sure you'll have a number of questions. So just to be clear, the purpose of the report is to provide you with the final version of the Scnd strategy for 22 to 25. And what we're looking for is agreement for this to proceed to Cabinet for final approval. And the recommendations that are that you're asked to review and agree the Scnd strategy, and as I say, endorse the approval of this refreshed strategy to go on to Cabinet. So just by way of a really quick piece of background, hopefully you've had an opportunity to both read the report and also to have a good read of the strategy itself and the associated documents. I got involved probably about just over a year ago, worked very closely with Danny and what was at the time called the Scnd Transformation team. And what we realised very quickly was that things had changed significantly, and whilst we had a strategy for 2018 to 23, we felt that things had changed. And I always think that it's important that you have a strategy that you can work to, and then you can set yourself some key performance indicators. You can have some plans which will enable you to actually achieve that strategy. And when I read the strategy, I felt that it was somewhat outdated and life had moved us on. So to highlight the key areas that as you're aware, we've got an increased demand on our services and our provision, and we wanted to reflect the need to work on that within the strategy. Also to capture the improvements that have been undertaken by the Scnd transformation team. And then, as you'll be well aware, the impact of COVID that has had both on children and young people, parents, schools, and the services within the local authority. So we felt that it was a good time to do a refresh of the strategy, and to actually build on the work that had already been done. But as I say, to identify that, but then actually set out some ambitions that would move us further on. I think the other key point to note is obviously you've spent time this morning talking about the Children's Services strategic plan, and the other thing that we were really keen on is that our plan aligned with that plan. In other words, that those ambitions flowed through. So we didn't have a discrete document that didn't have a direct link back to that plan. So we took the 5 ambitions that are in that plan, and we've changed we've used those. We spent a lot of time looking at those ambitions and interpreting what they might mean for Scnd, and we came up with 5 headings that are verbs that we felt described very strongly the areas that we needed to work on. And bearing in mind that this is a very public-facing document, we wanted it to be an engaging read and a very clear read for people that would be able to understand where we were setting out our ambitions, and then more importantly what we were intending to do and what it would look like when we get those achieved. So just a little bit I wanted to pull out about how we intend to communicate the strategy. Danny will talk about the engagement events that we've had up to now in our engagement strategy. So there's been a lot going on already with the strategy, but the idea is that what the key parts that we want to communicate are our 5 Scnd ambitions, which I say directly link back, but also to outline how we're going to deliver those. So the key difference here is that we're very keen that we have a very concise and clear action plan for the different services. There's been a lot of co-production on this plan again, so it's been social care, health, and also education that have been involved in developing this plan, but in consultation and very much working as part of a team with Parents Carers. So I feel really pleased with the way that this plan has come together. The key thing is that we also share the key performance indicators. So we're going to be using our local offer to communicate this information. I'm going to stop there. I'm going to hand over to Danny that will tell you about how we've gone about making sure that we've got that level of engagement so that the plan will be adopted and used widely by everybody. Thank you.
Good morning, everybody. I hope that you can see the slides in front of you. I'm just going to flick it into slide mode. So yes, as Tony says, even in the context of COVID, we have conducted a significant amount of stakeholder and external engagement with the new strategy. When we came to see you last, obviously we shared with you the draft version of the strategy and the new vision, and the key line is that we will be proud to say that Scnd is everybody's business across Hertfordshire. This has been the vision that we have taken out. You'll be pleased to know that nobody disagreed or had any comments on this vision or any changes, but this was sort of like our salient message that we took out to everybody. As Tony said, these are our Scnd ambitions, and the verbs that were the key messaging that we used throughout all of the external engagement, and also of course shared the key actions and measures as well, and I'll talk a bit more about those as I go through. So as we agreed at the last panel meeting, we have conducted a series of external events as well as online events. That was really, really important to us, understanding the current feeling around Scnd, the challenges that we're facing. We wanted to be very present and publicly available for comment from parents, carers and families. So we have conducted 4 events. They were conducted across each quadrant of the county. That was again very important to enable people to attend. And for those that were unable to attend a physical event, we developed an online event on our local offer, so people could come and find out about all the different organisations, the strategy itself online, as almost like an online sort of replica of what's happening physically. We also communicated obviously the aims of the strategy, when we were looking to launch, and how we'd be delivering the strategy moving forward. Here's some of the photos of some of the events that took place. As you know, we invited organisations that from grassroots up to sort of professional organisations to attend each of the events across the county, as well as the Scnd Strategy programme team as well. And basically we want to share with you the level of engagement. So as you can see here, we grew in attendance as the events took place. The first event was very early in September, and I think there was a level of nervousness around COVID and public events, but this very quickly stepped up with engagement as we progressed through the events and attendance from families. What was also really lovely to see was professional groups who hadn't been able to see each other for 18 months face to face. The scale and level of networking that took place was incredible, and maybe wasn't something that the team had really respected was needed and would take place. And the feedback from a lot of professionals was why they're not more professional forums for engagement around sort of Scnd services and activity, and that is something we will be looking to take forward. And of course, the engagement with families was incredibly valuable, and as you can see from the figures, stepped up as the events took place. As well as that, we held online webinars, and these were co-delivered with our HPCI colleagues, Hearts Parent Carers Involvement colleagues, and again, were well attended. So well attended with the level of feedback is that we have now agreed with HPCI that we will run quarterly webinars to update on Scnd services and the Scnd strategy for families to attend, and they will be quarterly to report on progress and act as our accountability as well. We also started having the health webinars as well. So we had an initial health engagement webinar around the strategy, again, very well attended, sort of 37 professionals from a wide breadth of our health sector. And also we led an education Scnd strategy engagement webinar. We had, two of those, and 88 professionals attended those. To add to that, as part of the feedback from the last panel, was shared that you were very keen to see how we were engaging with governors. I can confirm that we have some lovely press articles, some articles going out in the Governor newsletter, and we're also going to the Governor conferences as well. And then, of course, internal webinars as well to communicate that internally within HCC have also taken place. Entitled Scnd is Everybody's Business. It was also really important for us that these were recorded. So we have one main webinar that was recorded by HPCI with a sign interpreter, which we'll also have also put on the local offer. So that showed that we had obviously a significant amount of online engagement and events, as well as the public facing face-to-face events as well. On top of that as well, our online engagement. So we obviously have our Hertfordshire County Council corporate communications team, and they heavily supported on communicating our messages around the Scnd strategy, as well as our super local offer, Twitter and Facebook feed as well. So the two sides worked well together in communicating messages around the Scnd strategy events and feedback more generally. To say that the webinars had taken place, and also on top of that, as you were aware, we were leading a Scnd strategy drawing competition. This had 52 entries in total, and we've now awarded the 5 winners. Those images are going to be used across children's services as well as within our Scnd strategy communications. And here's just some examples of some of the entries. These were publicly voted on via Facebook. And as I say, the 5 winners have been notified and those images have been confirmed. Key bits of feedback that we received from parents, professionals, carers that we engaged with as part of the Scnd strategy engagement ranged from everything from how we will report on progress. So that is those quarterly webinar updates, the local offer updates around progress against the key performance measures, but also the actions that we're undertaking. But we felt it was really important to really sort of stress that the changes the Scnd strategy would make and the difference that it would make. And here's some of the key things I thought was really important to share with you today. So we are aware across the county that we have got a challenge around special school places, and from that we have developed a new special school place planning strategy, and that is refreshed yearly. On top of that, we have what we're calling Hotspot development sessions. They take place on a fortnightly basis, directly working with our school planning colleagues to identify where we've got areas of real need, and what we can do in the short term to deliver school places. So that's a key difference that the Scnd strategy team and strategy itself is making and working on. The development of the early help offer. So this is enabling us to have earlier indication and identification and response to support families, and that's a significant piece of work the strategy will undertake. I am part of the Scnd Pathway Review team, which is looking at the statutory Scnd service and capacity in that area. I can confirm that we are going through consultation at the moment of the development of that service, and that is well underway and going well, but that is a key backbone and foundation of the delivery of our Scnd services. The Scnd strategy will work and is working. The programme has to date worked tirelessly to improve working relationships across education, health and social care, and it will continue to do so. And this is the golden thread that will enable that. We are working to develop and improve the use of data and systems. We have made significant progress around that on how we use online systems around annual reviews. Implementation of things like the travel payment cards to support families, but there is more to do, and we want to evidence that through the data that we bring back to you to communicate progress. But overall, we want to use the new Scnd strategy collaboratively to act as a platform to not petition, but to flag the need for additional support, resource and importance for the development of our Scnd services to get the adequate funding that is required to deliver our services, and the Scnd strategy is the platform to do that. So yes, I'm really keen to stress the key points that we're looking to achieve. To reassure around the reporting, as I said, public accountability was very important to us. So through HPCI, we will communicate on a quarterly basis and have webinars where we'll have a panel, as we have done throughout the engagement, of education, health and social care to hear feedback. But we will also internally have our 8-weekly cycle reporting to Scnd Leadership Group. The next one is on the 25th of November, where they'll be confirming the action plan. And then obviously on to members to again share progress, and that will link into the quarterly updates, with the first update coming in January to share the baseline, and then on from there quarterly around progress. And then behind the scenes, just so I can share with the slides, is just so you're aware of how the reporting works behind the scenes, so you're really reassured around the governance and delivery model that we have behind the scenes to ensure that we do deliver this strategy to time. I think that gives you an overview of our activity. Tony, is there anything you wanted to add?
No, sorry, my microphone. That's fine. Thank you. Well done, Danny.
I'll hand back over to Terry if that's okay. Oh, do you want this? I'll take the slide down if you'd like.
Slide down. Thank you. Thanks, Danny. That was really very comprehensive. At the moment, I have only one hand up, which is Mark Watkin. Joe or Tony, did you have anything to say in relation to my statement earlier on? Have you got anything to add around the Scnd Hertfordshire Scnd Crisis Group survey, please?
Thank you, Chair. Yeah, I'll just make a couple of comments, because I think, as you said, I mean, the Scnd Crisis survey, I think it had 170 people respond to it. And I think it's important to say that we take the messages that came out of that survey, albeit a small survey, very seriously. And indeed, they resonate with us, and they resonate with the strategy team, Danny and Tony. And the key messages that came out of that survey around, I can't get hold of my Scnd officer, or they're not replying to my calls, or there's not enough Scnd provision in the county. Those two key things are right at the heart of the Scnd strategy that you've just had presented to you. So we take them very seriously. We've heard those messages and we are acting on them, and we will continue to report back here and back to children, young people and their families on our progress. A couple of quick things. I mean, Danny talked very briefly about our special school place strategy. Panel will know that over the last couple of years, we've created over 230 new special school places in the county. And in addition to that, this current autumn term, we're creating an additional 70 new places for children and young people. That said, we know we've got a lot more to do. Over the next 4 years, we'll be creating in excess of 340 new special school places. And alongside that, we're creating at least 200 special resource provisions for children with autism and communication difficulties alongside mainstream secondary and primary schools. So there's a huge amount of work in hand to address some of the really important points that have come out of that survey. We know that at this present time there will be children and young people whose needs need to be met today, right now, and we're working with those individual children and their families to make sure that we've got tailored provision in place for them. And secondly, you know, the pressure on frontline teams, both across the council services, but also across health and other people working with SEND, including our schools. You know, that's well known, and we've seen that massive increase in numbers of children with education healthcare plans since the 2014 reforms. What the council has done is, as you said, Chair, has agreed a significant investment of 1.5 million this financial year into the SEND teams to enable us to build the resilience and the capacity of our frontline teams to do a good job, to get back to families with SEND when they call us, to keep them up to speed with the progress of the statutory assessment, to provide a really strong customer service base. And we are now working really hard to build that capacity and resilience across the front line. So in short, the messages that came out of the SEND crisis survey, we welcome them, we've heard them, we are acting on them, and we're taking them very seriously. Thank you.
Thanks. Thanks very much, Jo. Thank you. By the way, for me, you've frozen your picture, so I don't know whether that's the same.
Have I? Apologies.
Yeah, I can hear you perfectly, but it might just be my internet. So I did have Mark Watkins' hand as being up.
It was up and it's still up as far as I'm concerned, Terry.
Oh, right. OK, it's gone down on mine. So let's go. Mark Watkin,
if you don't mind. First of all, can I say I absolutely welcome the SEND strategy. I think it's a tremendous statement of intent, and rather like the Children and Young People's Plan, it will be how it measures up against the intentions of the officers that we will want to keep a close line on. But I think, again, it's all about co-working. It's about reducing the use of out-of-county resources so that we get people, children, supported and served much nearer to where they live. And I hope it's going to mean also fewer educational healthcare plans if we can get early intervention in place, and we can get particularly schools better resourced so that they actually feel that they can accommodate the needs of these children without having to resort to outside agencies. And of course that will all lead on to reducing the pressure on the workload, on the workforce, I beg your pardon. I want to make two comments. One is about the engagement strategy. First of all, Daniel, you've worked your socks off, and I feel sorry that I wish I could say it had been a success. I mean, I went to the first event and it was remarkable. It was an empty hall, but I had a wonderful time. No, that's not really wonderful. I had a very informative time visiting the various presenting groups who were there, and it informed me massively. But in terms of engaging with the families, it really wasn't a great success. And in fact, none of the events in that regard, I'm afraid, attracted that many families. And it's understandable when you think of the pressures that they're on just with their children. But then you look at the engagement over the social media, and honestly, it's not that impressive, I'm afraid. You know, in this day and age, people are very used to this, going on to Facebook, going on to Instagram or whatever. And I really think this is an exercise for the county to work out why it was that we do have 5,000 families. You've quoted it elsewhere in response to the children, the pressure group as comments, but they actually got 170 families to actually engage in some depth about what they thought of the service, and yet the numbers that have been shown to us don't indicate there's a great deal more, and yet you've used all your resource. So I'm absolutely sympathise, because you worked your socks off, and I thought your report was very good, but I have to say I wasn't impressed with the engagement that was achieved. And I am going to go back now to that underlying issue that's in the front of all our minds following the emails that we've received from that group, And I'm going to ask a very simple question, which is, what is the workload on the Scnd officers in terms of number of cases at the moment, and what is the target we expect them to run to, so that we can get some idea of the disparity between where they are and where we want them to get to. If somebody can answer that today, that would be very helpful. Otherwise, we'll come out as a feature report, because I hope we will get a more detailed report in response. And I understand, Joe, your comments, we are acting on the complaints, etc. That's fine, but I'd like to see something really quite hard-edged, which says, you said, we did, kind of thing, that really gets to the heart of what they're saying. Because my experience has been, having supported quite a few families, I read that report and nothing sounded unusual to me. It's a kind of world I recognise from. I know I'm seeing only a small section of people, but I have found so many families who struggle to get engagement with their Scnd team, not because Scnd team don't want to engage, they just haven't got the facility to do it. Thank you. That's what I'll say.
Okay, thanks, Mark. I'm sorry that you thought the engagement was poor. I believe that families did engage through HPCI as well. So, but I'll let Danny comment on that.
I think it was the numbers I was talking about, Terry, the actual active engagement by the officers, and I quoted that. I thought Daniel did a great job in what he set up, but I don't think she had got as many people engaged as she might have wanted, I think.
Okay, so Danny, can you comment on that, please, if you're able to? And then I'm going to ask, am I going to ask Joe or Tony to talk about workloads?
Yes, Terry, I can confirm. So the first event, unfortunately, yes, was in the first week of September, which was also the first week back to school. So the lower attendance, I think, where Mark did attend that event was low, and it was more heavily professional led. We had more health professionals actually attend that event. But I can confirm that the attendance stepped up throughout the month into October. Appreciate that was sort of a maximum sort of 30 to 35 families. But understanding, it was a face-to-face event, it was during the school day, people's nervousness around COVID, I think it was fairly well attended, bearing in mind all the different pressures and variables that were in play. And that is also why we led all of the online events and webinars, which obviously then stepped up that engagement further.
Yeah, so I mean, what you didn't give in your report was how many people attended the virtual events. I know you showed the professional numbers, but you didn't show the actual family numbers on the virtual events. Are you able to tell me that number or not?
I can definitely circulate that. Let me just doubly check if I've got that. If not, I will circulate it around so everybody is aware. So yes, we had 35 families attend per event, and there were 3 events.
Yeah, but those are the webinars, are they?
Webinars, yeah, the family and carer webinars.
Okay, all right. So I suppose the next question that Mark will ask, so I'll ask it, is why didn't we get 170 families plus responding to our survey? I'll ask it because I know that's what's going to be asked. So.
Yeah, I think maybe was it the type of communication around the word strategy, and could it have been labelled as sort of community feedback? Maybe it was the wording on how we communicated. It wasn't a survey, so it meant that people couldn't just sort of fill it in around their sort of own timetable. So that might have been one of the challenges. But one of the reasons we're doing the quarterly updates is that people can continue to feed into this Scnd strategy. This isn't the end. This is a continual rolling live document. So we'll take on board the feedback and ensure that we broaden that engagement further for the next phase.
Yeah.
Chair, probably also just worth adding, I think the social media hits on Facebook, Instagram, or whatever, those were far higher. And obviously there was a lot of interest in it. But I take on board the comments, and we can go away and make sure that we build those comments into any future actions.
Yeah, okay, thank you. And what about workloads and targets, please?
Chair, we're bringing a detailed report, as previously agreed, to the next panel on that. So rather than get into the detail, what I can acknowledge and have acknowledged is that our caseloads in our Scnd teams are too high. We are not comfortable with how high they are. And indeed, it does undermine the effectiveness of the teams as a whole, insofar as how quickly they can respond to families who need urgent decisions or urgent, replies to their emails. So hence the investment that I talked about in this financial year to pull down. But what we will do is bring, as previously agreed, to the panel in the new year, detailed information about caseloads, both now but also moving forward, what we expect them to reduce to, and it's probably best if we leave a more detailed conversation on that for that panel.
Okay, fine, thank you very much. So now I've got Nigel.
Thank you, Chair. And like Mark, I overall welcome the this report. I mean, you know, I don't want to keep harking back to years ago, but I've been on this panel many years, and so often there's been, you know, Scnd reviews, different Scnd strategies, and so often people have said, well, here we go again. But anything that does improve the Scnd offer to our children and to our parents and our children is welcome. And obviously the vision that you've got on the 8 Hertfordshire professional promises sum up very well to me what the strategy should be, and we hope that they're taken to heart, those in the vision. And I don't, no one could disagree with that. And I think that the report by Danielle is excellent, and all the hard work she's done and that you've done is obviously to be welcomed. And again, on special schools, one would like to see more school places. I welcome the ones that we've got, and obviously I think it's important that we do push for the money and the work to actually have more school places. But obviously, as we've all mentioned, we can't dismiss the emails and the reports we've had by just saying, and I know you haven't, but well, they're only 170 out of 9,000 or whatever. Obviously, that's a very damning report, what we received in some of the emails overnight and this morning. And clearly anybody who, and obviously we shouldn't just take that out of context, but we do need to take on what they're saying. And the big issue clearly is the response of social workers and officers. And clearly that's why people are asking for workload. So if we, you know, I'm not asking for details now about that, but if we could be provided with the workloads, because we'd have to ask for that when you see a lot of those comments from those parents. And clearly, if there's a real shortage of officers and time, then that needs to be looked at as an overall, as part of this strategy. So, you know, overall, as I say, I welcome the policy, and clearly, you know, something that's been drawn up with Tony Fitzpatrick involved. You know, one's always going to take seriously. I know he's very well respected, and all the work he's done. But again, I would like to hear the same sort of answers that those parents are asking about, you know, not being responded to. You couldn't, you know, hear that, see that report and read those reports and not take them seriously and not want reports back. So, you know, I welcome the fact that there needs to be some kind of action plan on taking account, you know, of why those parents are so frustrated and those families feel so let down, because we need to think not just the families in the system now, that those are the ones that are coming after. So, you know, I do want to see that we improve there. Can I just ask one thing to Danielle? She does mention on the pathway review, the implementation of recommendations and restructure will improve communication between schools and the local authority. That's clearly, looking back at what's been said, a very important thing. I just wondered if she knows how that is happening. How are you actually going to do that?
Thanks, Nigel. So I can answer that, as I'm on the team that's looking at the restructure and was working on the review. So that is through the redevelopment and the restructure of the statutory Scnd team. We are now through the first phase of consultation and are implementing the leadership team to go in before January. And then from early part of next year, we'll do the second phase of consultation, which is the operational areas. And the way that we're looking to improve that is by capacity, so that there is more capacity and dedicated leads to work with schools to ensure that those calls, emails are answered and responded to in a timely way. And at the moment, it is due to capacity and the breadth of role that officers are carrying out across the whole of the statutory Scnd pathway. So all the way through from assessment to review, our Scnd officers are covering all aspects of that pathway. And in the new model, they will have a focused, targeted area that they will be working on, which will support workload, capacity, and areas of responsibility.
So can I come back, Chair? So does that mean, it doesn't necessarily mean we'll have more officers, or does it? I mean, will we have more, or yes, the ones we've got, they're different work? I mean, that's what we need to hear.
Yes, there'll be more officers, but with more of a targeted remit, which enables people not to have the overwhelming breadth of areas to cover. So as well as having more capacity, more resource, a more targeted focus area to be working on and responding on.
Okay. Right, thank you.
Thanks. Joe, you've got your hand up. Did you want to say something?
Just very briefly, Chair, if I may, because I just wanted to, Councillor Bell, come back to Nigel. I welcome his comments, just for the sake of clarity and to make sure there's no confusion. Far from dismissing the Scend crisis surveys, as you indicated, we may. We are taking it very seriously, and I just wanted to be really crystal clear on that. We have read it. We are taking it seriously. It tells us what we colleagues, the broad body parents within our Hearts Parent Forum that we've been constantly engaging with have been telling us the same messages are coming out around capacity within the Scend teams and real pressures on the provision for Scend in Hertfordshire, and we have built that into our strategy and our action plan moving forward. So we take it very seriously.
Chair.
I can confirm that I knew all this actually before we got the surveys, but Nigel, just fine.
No, I just wanted to say back to Jo. I certainly didn't think she was. I didn't imply her at all. No, I was actually just coming back to what the chair said at the start when she said, "Oh, well, these are 170 out of whatever 9,000." I know I'm not saying she was dismissing it, but that might be what some people from outside might be thinking. So I certainly didn't.
I clearly didn't say that, Nigel. I did not indicate that. What I was indicating was this is 170 people feeding back. Now, if we get 9,000 people feeding back because of this now, because I suspect that's what's the group are going to try and do. Remember, this is a pressure group, a national pressure group. We are doing the best with what we have. And I think members should be pleased that we've got an additional investment where we can actually work with our staff, because they're the ones under pressure and really feeling it. Politicians take on pressure, don't they? That's what we put our hands up for. But actually, our staff don't need to be treated sometimes as badly as they are being. So I'll no go more on that. So Fiona, please.
Yes, thank you very much. Can you hear me okay? Yeah. Thank you. And thank you, Jo, for addressing the concerns from the crisis group. Like colleagues, I too received several emails, and I think it's imperative that their concerns are taken seriously, which you have absolutely reinforced. So thank you for that. And thank you, Danny and Tony, for your presentation. So I absolutely welcome the strategy, and I was very pleased to hear Danny stress the importance of how the strategy will make a difference, because that's critical. And for me, it will be about the outcomes, the KPIs, and how we move forward. So I'm pleased to see that outlined and how the information will be coming back before us as a panel. As a new councillor and new to this panel, I have a lot to learn, so it's very helpful to have this all set out. So thank you. I was going to ask about workloads, but obviously Jo has covered that, and you'll be bringing a paper back in due course, which I think is going to be very important. We know the pressures on the Scend system. We know about the challenges, and it's very important that we're open about them and that we look to address them. But the figures in the report was it pages 63? The numbers are significant, and I think, Teresa, the point you just made about we recognise there are issues and we are doing what we are doing, and with the additional investment, hopefully we can do more. And I think the monitoring is going to be critical moving forward. And Danny, just a question on the engagement, and I hope you're not too bruised from those comments. Engagement can be very, very difficult. I wondered, have you considered maybe SurveyMonkey on an annual basis, just short surveys? Strategy can maybe put some people off. It can terrify some people. It's too meaty, it's too lengthy, but actually 5 questions on a SurveyMonkey that you can do on your phone actually you might reach a group that you haven't previously reached. Just wondered if you'd like to comment on that. Thank you.
Yes, Fiona, that's a great idea of doing some short, sort of sharp surveys. I'm also really mindful when HPCI put things out as well for things that they're sort of communicating. So yes, as long as I tie that in with our colleagues at HPCI, that's definitely something we could do, particularly maybe around the face-to-face webinar, so we can inform maybe questions at those.
Okay, thank you.
Okay, lovely. Thanks very much, Fiona. Thank you. The challenge always is, isn't it, how you get to the people? But we have contact details for all the families, so we should be able to and share it with schools. Sorry, I keep losing my voice today. So I've got now Mark Mills-Bishop, please.
Terry, we're very close to 11 o'clock. I just wondered if I waylay my question until we have the 11 o'clock armistice.
We're not there yet. We're 10:58. So can you ask your question in a minute?
Right, I'll do it very quickly. I welcome the support then for the report given by my colleagues there.
Okay, then, Mark. I've got my alarm. So we'll now 2-minute silence. Thank you, colleagues.
Two minutes has passed, Chairman.
Thank you very much, Michelle. Thank you, colleagues. Thank you. Mark, would you like to ask your question again?
Okay, yeah, I was saying that I welcome the comments made by my colleagues in support of the report. I think it's a very good report. It does ask some very difficult questions, and I think we all agree that the crisis support group asked some very serious questions, and as Joe has put it quite rightly, and you, Chair, that we do take it very seriously, and I know that they will come forward with some answers around that. I had a couple of questions, but Joe has answered that in terms of provision of places, I think, in the immediacy and also the long term, which is very important. And the other question was around workloads, which I've asked before, but again, we've had the answer on that. So I'm left with one other question for Danny. And Danny, we've heard about communication, we've heard about numbers, we've heard about how we get out there. I see from your report that the launch of the Scnd Strategy will take place in January next year. Now, how are you going to do that? Is it going to be a soft launch? Is it going to be all singing, all dancing? Are we going to wipe away the January blues? Are we going to compete with the January sales and really launch it in a big way? Have you got any ideas around that? Thank you, Chair.
Thanks, Mark. And I think that was the idea really of us starting the engagement early to get the feedback, is that we don't want just some big bang where you have something really big and glossy and then like a firework it sort of dies out. The idea is that we keep growing this engagement and we keep the strategy alive. So from January, hopefully if it gets approved in Cabinet on Monday and then you approve for it to go forward to that point, what we would like to do is tying into the Children and Young People's Plan launch will be part of that launch. There's that golden thread that goes all the way through. As I said, there's governor briefings, there's school briefing packs going out to all schools with easy read versions, posters that will go out in January. And of course, and there'll be sort of an online promotion of the strategy launching. But then it is the continual build. So those quarterly updates, webinars, sessions for people to keep finding out about progress that we are making. So yes, so it's that ongoing launch, Mark, rather than just, yes, as you say, a big bang.
Okay.
All right. Thanks, Danny. Thank you. Paula.
Can you hear me?
Yes.
Yes. Thank you, Chair. Thank you for this report. It was very, very informative for me. I actually went to the Neeland Centre in Bushy, and it was actually very busy when I was there. And I learnt so much by going around the different tables and talking to different groups. How many of those people were professionals and how many were families? I wouldn't know. I didn't think to look at that bit. But the only thing I would say, it was a little bit out of the way. And I just wondered if we're looking at this to do this again, because it was so informative, so useful. If somewhere that's perhaps a bit easier to reach, if you don't have a car, or even with a car, it was a little bit hidden away. It was that's just one of my comments there. So pleased you are really, really taking on board and listening to us, that you the fact now we've got good liaisons with governors, that there's fortnightly planning with schools. This is the grassroots level, the schools, and I know how they find resourcing and dealing with SEN and putting the right structures in place, and the people there that they need to support them is so important. So I'm really glad that's happening, and it's becoming a fortnightly planning issue. I too have received all the emails, and I totally understand the staffing levels, communication. When you have a child who has SEN problems, you're already stressed from dealing with those, and you need as much support and help as we can offer. And that's why I'm so glad we've got the 1.5 million investment coming in. And so we know officers must have worked very hard to get that, and that will make hopefully a big difference to where we're going. And also that we are really taking this on board and looking at it, how we can, we've got 340 new special school places coming in. So as our numbers are going up, we can hopefully give the best we can in the circumstances to our children. And that especially means bringing them into places which are in Hertfordshire and nearer to their families rather than sending them away. So I was really pleased to hear that we have all those new places and the new resources for autism, children with autism as well. That was really good. And that's going to make hopefully a lot of difference to our families. The only thing I sort of do know about sort of professional area is often there are quite high levels of absence amongst children with SEN in schools, actually. And I just wondered if we are looking at that as well. That's just a little separate strand. But thank you very much for your report.
Thank you. So Danny, do you want to take that question of inclusion on, or shall I go to Tony?
Yes, yeah, so best over to Tony around inclusion for that pathway.
Thank you. Tony.
Yeah, no problem. It's a very good point, Paula. Yes, we are looking at, certainly within the strategy, there are plans to continue to look at attendance of children particularly with EHCPs, because they are often children that aren't in school all the time. So the short answer, we can bring back some information on how we might be doing that, but the short answer to your question is yes, absolutely.
Yeah.
Thank you. Thank you, Tony.
Yeah, we're looking at everything that affects young people, special needs. It's sort of just taken it as they're a special area, but yeah. So Anthony, please, and then Calvin.
Thank you, Teresa, and thank you again for the report, and to Tony for all his work and colleagues. And I think it was a very good report. I just wanted to make one point and ask one question. The point, I mean, it's going back to the issue of engagement, and where, I mean, explanations have been provided in terms of relatively low numbers, but if you totaled up the numbers who attended the events of parents, it was only about 100, and then we have 170 completing the survey. And I have to say, what has jarred, and I'm thinking if I was a parent who completed the survey and was listening in, and I have to say that, as Nigel said, I thought the tone was a bit dismissive. That may not have been intentional, but so it sounded when you said 170 out of nearly 7,000. I am reassured by Joe's pledges in terms of work that's currently underway, and that we'll get a report to the next meeting. My question is down a slightly different track, but also I hope a fairly fundamental one, which is that, and I've heard, of course, that there is money that's been put in already this year, and you're hoping that there may be further money next year. But it's really the sort of fundamental issue of funding for SEND. And I wouldn't say money is the root of all evil, but it's certainly one of the roots in this particular issue and area. And I'm not going to go into a personal history, but I sat on the county council between 1993 and 1997, and one of the things that had been developed very strongly in at that time by all groups was local management of schools. One of the consequences of that was that a lot of money was delegated to schools, so the central pot was not large. SEND money is now allocated in part based on the central pot that is available. What that has meant in Hertfordshire is that we don't get as much as other counties because our central pot has been diminished, and I understand that we are presently the 4th lowest funded authority when we should be, based on our needs, the 25th lowest, and my suspicion is that sum is actually quite a substantial one. Now, my understanding, and I've sat on this committee panel for 4 or 5 years, and I know probably going back some years, representations have been made. But really, I suppose probably it's a question to you, Teresa, is, what recent representations have been made to government, to the Department for Education, to right this historic wrong?
I can't give you the exact date of the letter, but in mid-October, Terry Duris wrote to central government exactly on this matter. As soon as there was a reshuffle, we wrote the next day. So I know that I wrote on complex children's care, and Terry wrote on funding. So we've written as quickly as we could. It is our we are constantly talking to MPs about this, and I know that there's an MP breakfast coming up, I believe, next week, and I believe that Joe, or whoever attends that, will be talking to MPs about that, our own local MPs, that is. So personally, I'm onto it the whole time via my LGA role. It's something I'll bring up at the NCAS conference during November. So I can assure you we are constantly lobbying on this particular matter. I suspect the problem is that you review ours and then everything else changes. So it's not just us, it's everybody else. But Anthony, we're on it. We're trying our damnedest, can I say?
May I just have we had a response from either of the two letters that were sent? I know it was in October, but
yeah, I don't know whether Terry has. No, I've just got one last night. I haven't digested it yet, but they did note my concern and referred to the Scnd review coming up, which I understand from the webinar that I attended yesterday. We should see a white paper consultation in spring, which is useful, possibly, but that's going to be aligning with a school's white paper as well. So there's quite a lot happening in the spring, so we'll have to keep our ears and eyes open and be ready to respond. Okay. Is that all right?
yes, I think obviously as soon as you get anything that is substantive, it will be really very helpful for us to know.
Yes,
whether it's positive or negative.
Yeah, no, absolutely. Okay, thank you. Calvin.
Yes, thank you, Chair. I welcome this strategy. I certainly welcome the very high ambitions and that it has for SEND, and particularly I note the way that the professional promise within it is very much centred on the needs of the young children and young people. So I welcome that. Obviously, with all that we've heard through the survey, but also other correspondence that I've had from residents in my division, there are a number of issues with it at the moment, and I'm pleased to hear that they are being taken seriously, and look forward to future reports. One of the things I'm particularly pleased as a substitute member was the glossary that was in there. That was extremely helpful for me, so thank you. My question really is around measuring progress with the report in future. I noticed there are a number of measures within the plan, and that's good. Not all of them indicated what was good. Some of them said, increasing numbers. Some of them just said what the measure was without actually saying what we were looking for. And perhaps there may have been more in terms of timescales and actually the levels that you were looking for progress. But I appreciate that there's a lot of investment and a lot of changes going on, so that may not be something that you're able to nail down straight away. But actually to have seen something more of those of that in the plan would have been good, and perhaps something more of that in the reports that are coming to the panel in future. So thank you.
Danny?
Yes, Calvin, thank you. And I picked this up with Teresa yesterday. So we'll come back with the baseline measures in January, and we're taking the action plan to our SEND leadership group to agree via health, education and social care on the 25th of November. So there are some tentative deadline dates in the action plan at the moment, but we wanted to firm those up, and we will bring those back to you in January with the baseline measures. So you'll have all of that ready for the new year.
Okay, thank you very much. Dee.
Thank you, Chair. I think this is a very well written report. Like most reports, we can always read it and interpretate the good and the bad and the bit in the middle. So I welcome that, and I'm glad that it's been acknowledged that, like everything, we can always improve services going forward. And I think that's really important. What none of us have mentioned so far, the educational plans are the core part of this report, but also over and beyond that, there's a lot of good that goes on within the county regarding disability supports and supporting families outside of the educational remit. There's a lot of charities, a lot of good partnership working across the board. And I think we should also recognise the work that our volunteers do within that group of people. So well done, well written report. Thank you. And I'm glad it's been appreciated and acknowledged that we can always improve going forward. Thank you.
Thanks, Dee. Yes, you reminded us very clearly of our colleagues in the third sector who work really hard to try and help these young people, and very often that's what gets the young person through. And the local offer does clearly set out where those resources are. So yeah, thank you very much for that reminder. Leslie.
Dee's actually just said much what I was going to say, but I would say I would welcome this report. It does give us confidence that everything that can be done for our SND children will be done, and they'll be helped, if at all possible, within the budget guidelines. I can understand that there is a limitation on money, obviously, but I do feel that our officers and the councillors that are able to are doing their best to get the best for our children in Hertfordshire. So all attempts will be made to do what we can for them. So thank you very much.
Thank you, Leslie. Thank you. If I can just finish off here, can I thank all officers for the work you're putting in? Can I once again reiterate my thanks to all the SEN officers for all the hard work that they put in all of the time, all of our teachers across the SEND system, everybody in the system. I mean, it's a system that has to work. So every single partner there. And can I just finally make it very clear with my opening statement, I was not being dismissive of the 170 families that took part in that survey. I just wanted to reflect that we have a very large number in this county of families with children with SEN, and we have to hear from all of them. As you've quite clearly pointed out to Danny, it was a smallish engagement, but I think it was a very important engagement because not everybody takes part in these sort of things, especially if they're happy. So if we think about it that way, you know, the majority are content. I suspect not, but you know, I think we need to look at that. But I can assure you, I was not being dismissive. And as I said earlier on, SEND is really, really important to me. So thank you very much. We'll now go on to vote on this, and the recommendation is the Cabinet panel is asked to note and comment on the content of this report and recommend to Cabinet that Cabinet approves the strategy. So please could you indicate in notes? Have we all voted? Has it all come in? Yes, that's all been approved. Thank you very much, colleagues. Now it's 11:21. I'm going to suggest that we take until 11:30, a break till 11:30. Is that long enough? And then we'll come back and do the sufficiency update. OK, thank you. See you in a moment. microphone. So thank you, colleagues. We're now live. Welcome back. Thank you very much for a really full discussion on those two very important topics this morning. We're now moving on to the next very important topic around our sufficiency for our young people, including that for unaccompanied asylum seekers. So we've got Lynn Knowles, who's Head of Commissioning for CLA and Safeguarding, who will present to us. Thanks, Lynn.
Hi, thanks, Teresa. So what I thought I'd do is go through the key highlights of the paper, and then I've got a couple of slides to show you, just to show where our children and young people are placed across the country. So for the purposes of panel, we're asking panel to note the contents and support the strategies that are in place. And the report is covering the sufficiency of placements, which is the local authority duty to provide sufficient placements for our children in care. We're also looking at some of the placement challenges that we're actually experiencing currently, and also what the strategies are to address some of those challenges. So briefly, just looking at the numbers of looked after children, we have seen a rise over the last, well, certainly, especially over the last probably 6 months. So the data that's in this report is actually based on data at the end of August. So the numbers then were 1,003, but the numbers today are 1,013. So there's actually been a slight increase since the report was written. And the numbers of unaccompanied asylum seeking children were actually at the lowest they've been for a number of years. Back in August, they were at 75. But we have now taken a number of children on the regional rota, and we've had some spontaneous arrivals in Hertfordshire, which are children who arrive in Hertfordshire through lorries at service stations, so that they called spontaneous arrivals when they arrive in Hertfordshire, and the numbers to date are back up to 95. And the average number we've had really over the past few years has been around the 100. So we're almost back to where, you know, we were with those figures. So as I said, the number of children looked after numbers have risen since the pandemic, and we've looked at the reasons behind this, and I think there's a lot of things happened during the pandemic in terms of just the general support in communities that family had. We've had a growth in the number of children in care proceedings, and we've had less children exiting care as well. The profile of our looked after children, so the majority of our children are over 10 years, so 70% of the children in care are 10 years and over, and 57% male and 43% female. In terms of location of children, 609 children placed within Hertfordshire borders, and out of those children that are placed outside the 394, as at the end of August, 111 of those, so quite a number of those, are actually placed with our in-house foster carers or family and friends placements. So they're placed out, they may have lived in Hertfordshire, the foster carers previously, and they may have moved out the area, and obviously the children go with them, they're in long-term placements. And if a child's placed with a family and friend, which is, you know, a very positive thing for them, their family friends placements may be out of the area. So that accounts for 111 of those children. We've got a further 150 children placed in independent foster placements outside of the area. And then we've got 51 children who are in specialist type provision. So they may be in hospital provision, they may be in specialist provision for harmful sexual behaviour, for example. Obviously our residential special schools, and then we have a very small number of children who are placed out of area because of criminal or sexual exploitation. So where we feel it's in their best interests to actually remove them from the community where they're really at very high risk of abuse. So of the children that are placed in Hertfordshire, 73% of those children are in foster care and family and friends placements. We have another 66 who are in independent foster placements, and we have 90 children placed in semi-independent. And semi-independent is for our children who are 16 years plus, and their placements that provide support towards independence. And it's probably the most successful area in terms of being able to source adequate placements in being able to place those children in Hertfordshire. So as I've referred to, the placement type, the vast majority of our children live in foster care or with family and friends, 70% of our children. We have 72% living in independent children's homes, and we have 115 in semi-independent provision. As I said, the majority of those are in Hertfordshire. In terms of unaccompanied asylum seeking children, the vast majority of those children are also placed within Hertfordshire, and we actually commission specific accommodation for those children. And what we find is we've got supported living accommodation where those children can sort of share really experiences, and where their needs are really specifically geared towards their specific needs, which are very different from the rest of our looked after children population, because their experiences have been very different. Just to say a little bit about the placement challenges we're experiencing at the moment, and they're quite unprecedented really. In the last couple of months, we've experienced a real challenge in sourcing placements for children. This is not a Hertfordshire only issue, it is a national issue. There's been obviously an increase in children in care, but we've also seen an increase in the number of placement breakdowns, certainly in some of our residential children's homes across the country, where providers are serving immediate notice on children and asking us to move on the same day sometimes. And that's about some of the challenging behaviours that they're experiencing and feeling they aren't able to keep the children safe in those placements. So the why is the placement shortage happening specifically at this time, I suppose? And it's interesting really to note that during the pandemic, our placement stability, which is the number of, obviously when we move children, we want children to stay in the placement they're in. So we don't want them to have to move to a number of different placements. And during the pandemic, our placement stability improved considerably, actually. And I think what we think is that across the country, almost everyone, because we're in lockdown and everything else, that people sort of seem to just hang on to things. And as we've started to come out of the pandemic, it feels like we've then seen things that people may have kept going with during the pandemic, they suddenly feel they can't carry on any longer. We're really not clear on that, but that's one of the things that we think has contributed to this. The placement market is really stretched. Getting the right type of provision for the children that we have in our care. We've seen an increased complexity of need of our children, certainly in terms of children with autism, challenging behaviour, girls with mental ill health, certainly increased presentation there. And the placement market hasn't quite caught up with the needs of those children. So when we're referring out, we're getting very limited choice in terms of where we can actually place them. And then there's also a skills shortage nationally, and we don't know if this is the same as within the adult care system, but certainly what's happening is when we're recruiting, and this has happened to us with our in-house residential as well, a lot of inexperienced staff are applying for posts. And if I think back historically, we used to get a real mix of people. So if you've got a staff team of children in a children's home where you have people with very solid experience who can manage the needs, who can, manage the children when they're at their best, but also when they're at their worst, then the team can grow and can manage and can stick with those children. If you have a group of new staff who aren't experienced with that sort of behaviour, that's when we're thinking that's contributing to some of the placement breakdowns and some of the placement challenges. So in Hertfordshire, we've got a whole range of things around our residential strategy that we're doing about that, which is a whole learning and development programme to skill up staff. And we're also going to develop a residential academy to grow people into the role. We're not the only ones who are facing the challenge. So our health colleagues are also facing a national challenge with inpatient beds for children with mental ill health. There is a significant bed shortage across the country, and across the secure accommodation network, there's a significant shortage of beds as well. So Hertfordshire very rarely place children in secure accommodation. It's where we've really exhausted every other option and we feel there's no alternative to keeping that child safe. But the secure network at the moment has, for example, 55 referrals on any one day with potentially only about 4 beds available. So that just tells you nationally, so that's not Hertfordshire, that's across the whole country. That just tells you nationally about some of the pressures that we're actually experiencing. Obviously, that leads to cost pressures, as you'll see in the paper. So when it's a sort of market-led costs, the costs go up. So our average placement cost has gone up by over £100, which is £1,226. That's because the majority of our children are placed in foster care. But our residential placement costs have gone up quite considerably. Some of that has been around our providers asking us for money for additional staffing, sometimes for waking nights to manage risk. So if we have children who self-harm, they may need to be under observation in those homes, so they may need additional staffing and supervision. And because there is a shortage of placement, providers have also unfortunately hiked up their prices. There was a report recently by the Commissioning Monitoring Authority which talked about there's a group of people who own quite a lot of the placement availability, and the profits that they're making are, of concern, and that's been noted. And there's been a number of actions proposed to address some of that, which is about having national or regional bodies to look at some of those and challenge some of the placement costs. We do use not-for-profit organisations in Hertfordshire where we can. So we have charity organisations that run some of our placements. And what we want is value for money. And the important thing for us is that any money that we're paying for placement, we want that invested into the children. So we want the staff to be paid a salary which is worthy of the work that they're doing. And we want the children's needs to be met and to get the best outcomes for them. And if the money's there, we will pay that money. What we don't want is large companies taking off profits from our children. So in terms of what we're doing to address some of these challenges at the moment within Hertfordshire, we have a fostering strategy, and I know Miranda's actually presenting her fostering annual report later, so I'll just briefly touch on that. Just to say that strategy is to increase the number of in-house carers we have, also to attract more carers to have our sibling groups and our teenage children, because they're the placements that often it's most challenging to place children with teenagers, and when we have large sibling groups being placed together. So there's a targeted campaign, and also to look at, because we're asking carers a lot in terms of some of the children where they're coming into care highly traumatised, some of their behaviour can therefore be very challenging. We have to put a support network around those carers so that they feel sufficiently supported to be able to care for these children. So that's the fostering strategy. The residential strategy, we're looking at increasing the number of beds, and obviously members have previously supported an investment into growing the number of children's homes that we have in Hertfordshire. It's a mix of children's homes, and we've already have 8 beds, and then we're opening over 2022 and then into 23, the remainder of the beds available. We're also opening a joint funded health and social care provision, really prevention of children being admitted into Tier 4 inpatient care, or when children are ready for discharge from hospital with mental health issues, that we actually have a provision that can stabilise them before they step on to another placement, which would be their long-term placement. So we're working with health colleagues at the moment to develop that, and that's fairly innovative. There isn't anything quite like it in the country. We're also got a whole recruitment strategy around getting, just as I referred to before, I guess, the right type of suitably qualified and trained staff to work in our children's homes. And the other actions, we've got a project called Inside Out, which is Norfolk, Essex and Hertfordshire, really looking at consistency of relationship for children whom placements might be unstable, or where we might want those children to return back to their families. And that is essentially a coach who stays with that child right through their whole journey. So they move with the child when the child goes, and they provide that intensive support to that child to help them really manage some of those changes. We've got a reunification project, which is about looking at children who might have been in care for a number of years, and where circumstances for everyone has changed really, where the child is older, where parent circumstances have changed, and where we feel actually it's the right thing to do to return those children back to their families. And we know that means working with the parents to strengthen their ability to parent, and also working with the children to manage that move. So we provide intensive support packages, and we've already seen quite a bit of success around that. And then our adolescent strategy finally, which is looking at those children in families where there's a real risk of family breakdown with our teenage population. And that can be for a number of reasons, really. Challenging behaviour in the family home, some of the influences outside of the family home, and parents really feeling unable to manage some of those risks and some of those behaviours. So we have invested money in looking at how we put support into those families to strengthen the skills of the parents, and also support the children to manage some of their behaviours really and meet their needs. So that's just a highlight summary, and I'll just finish with a couple of slides. Hopefully I could share these with you, just to show you where our children are placed in the country. So I'll just go on, sorry, can you see the slides? Yeah. Teresa, yeah. Yeah. So just thinking about placement locations, and obviously we don't want our children placed far away unless it's absolutely in their best interests. So on here you can see that the vast majority of our children, 87%, are placed either in Hertfordshire or in local authorities which touch Hertfordshire's borders. We're very well aware of the impact of moving children away from their family, friends and community. As I've already referred to, for some children that can be in their best interest where their immediate community is a danger to them. We do facilitate contact, so our principal belief is no matter where a child's placed in the country, we want those children to have the same service from us and to meet their needs in exactly the same way. So, you know, in terms of social work visits, in terms of quality assurance of those placements, using social media, facilitating families to travel to contact or children to travel back to Hertfordshire, involving those children in all the events that happen in Hertfordshire. So our primary aim is obviously that our children, no matter where they're placed, will get the best possible service from us. So I've got a map, and I apologise because you probably need a magnifying glass to sort of see the numbers on here, but it was the only way I could fit.
Lynn, can you just make it into one slide, enlarge the slide?
Oh, sorry, can you not see one slide?
I can, but it's small, so if you can sort of do full screen.
I think, oh, hang on a second, I'm not sure what you can see, Teresa, because I've got...
Well, I can see the side panel with both slides as well, so we just want the one slide. That might help us.
Apologies. Now I've lost my link to the screen. Apologies, I'll share that again. And apologies, this is not going well. It's
sorry.
Lynn, if you press the slideshow, that should bring it up into one document. The slideshow at the top.
What's happened is, apologies, what's happened is I've lost my...
Can Can you take control, Michelle?
I haven't got the slide, Teresa, so I can't.
Okay.
Again. Okay, shall I take control? Does that work? No, it's waiting for approval.
Yeah, I think we get the gist. Do we need to go through this? We're not going to have an analysis, are we? It just gives us a flavour of where they are, just to move on, do I suggest?
Well, we'll just see if we can get there.
So if I do slideshow and then...
Yeah, try that. No, it's not going onto a bigger screen. Okay, just talk to it, Lynn, don't worry.
Okay, so I mean, what I'll do is I'll obviously send that out to yourselves so you can see that. It is very tiny anyway, so you might need to look at it in a different way, but it just really illustrates that the majority of our children are close to Hertfordshire, and the children, yes, we do have some in Scotland, we do have some, and some of those are in very specialist provisions, and that's about meeting their need in the right place. So apologies for the
Okay, no worries, no worries. Thank you very much, Lynn. Thank you. So Nigel, please.
Yeah, thank you, Chair, and thanks for Lynn for an excellent report and very well set out. And in fact, the on page 109, the report listing the places where all 1,003 children, obviously there's more now, I know, was very useful. And to remind members the situation, and also the whole business, like at 420, the residential strategy. And I appreciate there's 8 already open, and we all support the 31 beds, and obviously the rest that are going to open in the next 18 to 24 months. But and also I think clear that the very fact that you're reviewing residential for all 16 and over is important. I also had down here about obviously page 113, the secure accommodation estate and the waiting list, or the waiting of at least 50 children. I know this is a national thing. I know Joe told me that yesterday in the briefing, but that's something to take in on board. And I also have got down here 613 Inside Out project, and again Lynn mentioned that, and I think that's very important, very innovative, the sort of thing that we need to, we could welcome. I don't know if it's going to go on for another year, but it's the sort of thing that's very good. And then later on, when you look at the page 122 on on there, it shows a stark reminder of the kind of issues with children and residential accommodation that we need to think about. But it's very very important. And I think the key thing as well is 417 residential in the county. So looking at the fact that I certainly have supported the other places that we've opened, but that it's not as simple as saying, as I think I said to Joe yesterday, oh, well, great, let's open somewhere else with 8 places, because we know that there's so many different complex needs with, say, boys and certain with girls issues, and that you can't, it's not just a question of more money to open a bigger place, it's about the kind of issues, and we may need more single places, I understand, single houses or flats. And again, it's a question, as we've raised before, about getting the right staff, to pay the right staff and getting the right trained staff, because when we have so many more complex needs children from, say, 12 to 16 and above, that takes more it takes more experienced staff, and I know how difficult that is. So I just think mainly comments really. I mean, it's a welcome report and very detailed, and it's good, as I say, to see it, and thanks for what you've presented. And I, again, on the Inside Out, I just wondered is there any chance that could be extended, or we get that again for another year, or with other sort of new working. And could you talk about the new farm at 612? And again, maybe Joe could mention again on the secure accommodation, the issues at 434. Thank you.
Okay, thanks, Nigel. Yes, so in terms of the Inside Out project, yes, we have got a funding agreed across the 3 local authorities to carry on that project, so we're really pleased about that. The Tavistock Clinic have done an evaluation report on that. So they've been overseeing this because it was a pilot and because there was DFE money involved initially. They've been looking at that, and certainly all of our local authorities have noted success with it. So yes, we're really pleased that we are continuing with that. The New Farm project is the project that I referred to, which is the jointly funded health and social care provision. And that's really children who, there are some children who develop, mental ill health for a range of reasons, often related to trauma in their histories, and where there's maybe self-harm behaviours, behaviours which are a concern, where sometimes it's felt, would a place in hospital for a period of time be better, or actually a place in the community where what we're doing with New Farm is we're going to have a mix of health and social care staff. So we will have a psychiatrist overseeing the provision, and we'll also have registered mental health nurses as part of the staff. So what we're trying to do is, where it's not in a child's interest to be in hospital, create an alternative environment where they will be supported intensively to manage some of those behaviours, to stabilise their crisis when they go into crisis. And for children who really are ready to come out of hospital, it's a place where they can go, which is smaller, which has a specialist staff around in order to move to their long-term placement. So we're really excited about this, and we're in discussions with our health colleagues at the moment, and we've had quite a bit of interest from other local authorities actually about what we're doing about that.
Thank you. That's good to hear. And and what would the age be of those particular children?
So they're most likely to be teenagers, Nigel. In terms of presentation with mental ill health, we're normally talking 13 years upwards is the group that we see.
Okay, thanks, Nigel. Thank you very much. Mark Mills-Bishop.
No, thank you, Gary. I took my hand down, and I anticipated Lynn moving on, and I was a bit concerned about supply and demand and unit cost. But you answered that question, Lynn, and I understand it. Maybe in terms of secure accommodation, do we have many cases in which we are concerned about, in which secure accommodation could be the answer, and we don't have a place or can't find a place for that? Do we have many cases?
Very, very few, Mark. So normally in any year, it would be 1 or 2 children that Hertfordshire might refer to the secure welfare estate. And they would be children where their missing episodes are of such a significant concern, where we've tried local placements, where we've also tried. So we have some very bespoke specialist placements, which are sort of in the Lake District, quite remote placements, to really try and break that cycle of the pull of the community and the negative influences there might be in the community for that child. So we would want to try something like that before we went to secure, because obviously it's a deprivation of a child's liberty. So actually Hertfordshire place a lot less than a number of local authorities. So in that sense, it isn't such a challenge to us, but it is a challenge nationally, the actual shortage of beds.
Right. And in terms, very quickly, in terms of,
to say something.
Yeah, in terms of COVID and the pandemic, and as we come out of it, and mental health issues and all those kind of things, has there been a spike, and does that cause a strain on the public purse for Hertfordshire?
In terms of mental health issues, Mark?
Yeah, that might require, if you've got self-harming, for example, or violent episodes that might require secure accommodation, potentially. Has there been a spike? Does that cause a problem? And does it affect the public purse for Hertfordshire?
Marion's going to answer.
Marion.
I was just going to add, actually, that's the other group where we can look for secure accommodation. So children who are on the threshold of having serious mental health problems, but they're not assessed as being able to be having a compulsory admission to hospital. So they're not sectionable, but they're very close to sectionable. And it has, over the last year, caused very significant impact on the public purse. in sort of two ways. One way is because if a child is assessed as requiring a hospital bed and should be in hospital, then that's a service that's already paid for through the public purse. So if there isn't a hospital bed and we end up looking after that child's almost effectively being double funded, once by the local authority and once by the National Health Service. Also, when we have what we do know is that across the Eastern region, there are more than 50 children waiting for a psychiatric bed. And we get the list every week. I think Hertfordshire, it's about 14 the other day, children who are waiting for a hospital bed. Some of those children are in the acute hospitals. So there are some children in the Lister. There are some children at Watford General. There are some children living at home. And at the moment, there's one child who's in our care. And that child is requiring an incredibly expensive, bespoke package of care because her level of self-harm and her level of violence towards other people is requiring that we have a really high staffing ratio. So we're having to commission a bespoke staff team, a very large bespoke staff team, to look after one child. So yes, it is putting a lot of strain on the public purse.
Okay, fine. Thanks very much. Thank you. I'll now move on to Mark Watkin, please.
Thank you very much, Terry. And as I said to Calvin, if he wanted to get a good idea about the challenges facing children's services, he couldn't have chosen a better meeting to sit in on. The only thing we're not talking about is youth work, but virtually everything. And the common theme is pressure. I just wanted to, a lot of what Nigel said, I would have said, so I'm not going to repeat it, but I just thought a couple of things. Marion has just made the point again, it's been made by several officers, about the national situation, particularly with the shortage of health beds. We've talked about you writing about the funding crisis for Scnd. Have we politically made a point of raising this nationally with our local MPs and ministers? If we have, I'd like to know what we've done. Can you share with us what's been done? Because clearly we are at the sharp end of what's not available. Secondly, more of an observation, and it's just about how you present the facts. Lynn just said, oh, the costs have gone up by £100. And I just go, oh, £100, yes, that's what I spend in Tesco's on a Monday. It's not that, it's actually £250,000 plus another, and I think we should be showing our figures of costs, of what it costs to have children, not in per week, but in per year, because that's what it means to the budget of this authority. And it's very easy to be seduced by small numbers, as if, turn the thing on its head. You want to sell somebody something, say, oh, it's only £1 a day, it's nothing. £350 a year, and people go, what? And it's the same thing. I think the message is even starker if you talk about it in the real budget effect. So that's just an observation. Yes, I think otherwise, Lynn, I think you're doing a great job. I did have one idea, and it's probably completely off the wall, but you've talked about the vulnerability of the authority to be able to buy or to buy services from private providers because they've got almost a monopoly on it, and this must be true of every authority. Has anybody thought about setting up a kind of HFL, but for accommodation? Why don't we sort of set together and create our own organisation that is responsible to local authorities, who then we can control what is an acceptable sociable charge. It's not something that's going to happen in a week. It may never happen, but I just think we need to go on the front foot. A lot of what you're doing is very creative, and I commend you for that. I think you're doing a great job in so many ways, so I won't repeat, but I think maybe local authorities may need to start saying, okay, we're not going to take this anymore. We will set up our own way of operating free from these people. My thoughts.
Okay. So, Marion, do you want to take that last question from Mark? Have we thought about doing something? I think we have, but I'll let you answer that one.
You're supposed to answer this.
Lynn, okay, right, sorry, okay.
Yeah, well, when we originally brought the strategy to Cabinet, actually, we did discuss whether we should set up something like a Hearts for Learning, but a Hearts residential type provision. And I guess when we listened to how that worked, we weren't sure that it would fit as well for the residential needs. And part of the reason for that is when you then have to change what you want to do, it becomes a little bit more challenging if you've already set up a system to work in a certain way. So just to give you an example, when we started off with this strategy 2.5 years ago, needs with this population change constantly. So when we started out, we were going to open a lot more sort of 4 or 5 bed children's homes. But as we've gone along in the last 2.5 years, needs have changed quite a bit, actually. And it's something that Mark referred to, is about the need for more specialist type provision or smaller provision to meet the complexity of need. And one of the things that we felt might be a barrier to that, should we set up an organisation like you've referred to, would be that could actually hinder in terms of timescales how we change what we've set up originally. So that was one of the reasons why we wanted more to be able to build in more flexibility.
Yeah, okay, thanks, Lynn.
Sorry, Terry, can I just add that we have got one group of children's homes that we commission through a partnership with a number of other local authorities, and we also have a group called CRAG, which is a cross-regional placements service, and that is actually hosted by Hertfordshire. So we host that on behalf of about 36 different local authorities, where we try to work together both on quality assurance but also on cost control across the region. I think it has just become increasingly difficult as placements for the most complex children have reduced in supply.
Yeah, thank you. And Mark, you asked about the political side of it. Yes, as I said earlier, I had written to ministers. I have had a response, which I haven't had time to read yet. And we're going to be looking at ways that we can work with them. So you'd also have heard in the spending review, there is more money being given to SEND and complex areas. There's also the social care review that's going to report in January or February. And Lynn made reference to the competition market report on residential care. Now that's really important because that's something that government can control. There's lots of recommendations there, and that's going to tie into the social care review as well. So there's a lot going on in the political world, and the LGA is playing a very large role in that, and we will respond as well in that way. Okay, so I've now got Fiona Thompson. No, I'm moving on, Marion. Sorry. Fiona Thompson.
Yeah, thank you very much, and thank you, Lynn, for this report and update. It's clear to see, you and your team have a significant challenge ahead of you, and I think it's very useful to, as a new member again, often the headline figure of the number of children placed out of county can be a cause for concern, but actually it's really helpful to understand that it's not always a capacity issue, and sometimes it is for the protection of children. Having said that, I understand there is obviously a capacity issue and staffing moving forward. It's not as simple as just throwing money at it, because actually it's about staffing, it's finding the right staff for these children who have very complex needs. And pleased to see the mitigation that you've set out in the report. Particularly, I'm a great fan of joint working, so to see the project you're going to be doing with health, I think that's going to be really interesting moving forward. And perhaps at some stage you could bring us an update, within a year, to see how that's progressed. Again, I love outcomes, so it'd be good to see how it's moving forward. I just wondered about the voluntary sector. I didn't see any mention of it in there. As a new member, maybe there isn't much joint working with the voluntary sector. However, I'm thinking of, I know in Welland Hatfield, we have a project with Hearts Young Homeless, which is the Future Roots, I believe, which is a step down for children over the age of 18, which we're just about to move forward with. And wondered if you could just speak a bit about voluntary co-production, if you like.
So we have the voluntary sector involved with our 16+ supported accommodation. So we have a contract with Heart Young Homeless. We work very closely with them. Also, our adolescent services work very closely with them in terms of children who are at risk of homelessness. So we do work very closely with the voluntary sector, mainly with the 16+ population.
Just maybe in future reports, it'd be nice to see the
voluntary
sector,
thank you.
Recognised in the report.
Yeah.
Thank you. Thank you, Terry.
Thank you. Lynn, can I just ask, do we work with YMCA?
Yeah.
You do as well. Yeah. So we've got various ones, and some of the residential homes are charitable as well. So, you know, but perhaps we can think about adding that to the report. Thank you. Right, I just wanted to say also, we're talking about co-production. I mean, it is very important that we work with the health sector in this particular sphere, and I see that I hope that the forthcoming ICS will help this a little bit. Better working, joint commissioning, understanding, you know, the roles keep changing within our own sphere and in the health, so we're losing personalities, and so we all get to know each other, then it all changes again. So it's important that we keep working on this one. So I think that's going to be very important going forward. As mentioned earlier, there is potentially funding within health that can work with us on this one. And finally, Anthony.
Yeah, thank you, Teresa. Really just another, I think, a question to Joe, probably, a long-term workforce question. I mean, workforce pressures, people have talked about it. That's clearly absolutely core to so many of the problems we're presently facing. And I'm assuming that most of the people we're trying to recruit probably, you would hope, have a sense of vocation. I mean, they are having to do enormously challenging jobs that most of us would retreat from. And I'm just wondering, I think sort of going back pre-pandemic, there was, I think, a feeling that actually the desire and ambition to go into vocational work, in social work, and was beginning to appeal to a wider range of young people. The awareness of mental health, I think, was a key part of that. And I suppose my question is this, to Joe, through you, are the national organisations, the national bodies, is there any sense that actually down the pipeline, and I know this is talking about maybe not immediately, but we have to be aware of the longer term, that there are more younger people coming into the types of work that you are seeking to fill?
Thank you, Anthony. And
Sorry,
actually,
that's a difficult question. I'm just wondering what the national bodies are finding.
Thank you. Sorry, there's a bit of an echo there. What I'll do is I'll answer your question, but then I'll just ask Marion or Lynn, I'm not quite sure who's the right person, just to give a bit of an update about what we're doing to recruit into this sector as well, because I know we've got some work in hand. Just on the broader issue, Anthony, you know, as you said, everyone is keen that we attract people into these professions, and they are tough professions to work in. And so there is much being done on a national level to attract people in across the whole public sector, but including social work, residential, etc. And I know many of the, you know, the bodies that you're talking about are doing a lot of work on that. What I haven't seen to date is whether or not that's making an impact. And it may well be too early to know whether those sorts of, you know, those more national campaigns are having an impact, Anthony, but I am watching them with interest, and certainly it's something that we support in Hertfordshire. We're doing a lot of work. We continue to do a lot of work to attract people to work in Hertfordshire in social work positions, as well as across children's services. Whether that's our, you know, recruiting new people in through frontline or step up to social work, or how we support our newly qualified social workers in the teams, we've got a really great offer, and we're very much on the forefront in terms of going out and marketing that and attracting people to work in Hertfordshire. In terms of the residential bit, Marion, do you all, I'm not sure who's best placed to put it, but a couple of words just on what we're doing around that.
Lynn did mention the academy that we're setting up. So we're setting up an apprenticeship scheme for residential workers, and we don't know anybody else who has done this. So what we're doing is we're recruiting people at quite a low salary, but they will be apprentices for the first 6 months. And they'll work partly in a children's home, but they'll also have lots of training and lots of work experience, shadowing workers from across the system. Because what we have done, we have a recruitment officer working on trying to recruit to our children's homes full time at the moment, which shows how seriously we're taking this matter. We've invested money in our advertising, but we're still not getting enough people. I think we're also trying to raise the profile of the need for more specialist training nationally for residential workers, and also therapeutic support for residential workers. We talk about secondary trauma, but that is just not recognised when we think about residential workers. They are the least well paid part of children's social care. Nationally, again, Hertfordshire matches very well in terms of other salaries that we've looked at. We pay as much as anyone that we're looking at. But it's a profession that people often don't want to go into or aren't equipped to go into, hence the academy.
Okay, thank you very much indeed. Thank you on that. So Anthony, it's on our minds constantly. D, final question from D.
Thank you. I think this is a very positive report, and we're taking a lot of strands and considerations, come to the forefront and in the focus. What I am pleased to see is that we really don't like sending children out of county, not just because of the high cost that's involved, but also because of the welfare issues. There might be issues with families trying to travel there to see the young person concerned, and that person will then feel isolated, and so will members of the family. So that is a two-way thing. So from the health and welfare situation, I think we're actually spot on at the moment. Regarding the apprenticeships and things like that you're going to set up, that's positive, that's to be welcomed. And clearly, I think officers are best placed at the moment to take the health and welfare of young children in Hertfordshire into consideration. And we seem to be doing the right things, going in the right direction for the right reasons. Thank you, Chairman.
Thank you, Dee. Thank you for your positive comments. Thank you. So, colleagues, we're at the to look at our recommendation. So I'm asking you to note and comment on the report, and in particular note the challenges in relation to current placement availability, which we've done, and 2, to support the strategies in place to address the sufficiency issues relating to children placed out of area. I'd like to take those both together, if I might. If you could all show your agreement, please, or not, as the case may be. Okay, thank you very much. That's great. That's gone through. Thank you. Grateful to officers for all the work that you do in this particular area. I know how challenging it is. Okay, so we're now moving on to actually item 7, Hertfordshire Adoption Service Annual Report 2021 to 2022. And Miranda Guitos, who's our Head of Adoption and Fostering, will give us a brief presentation. Thank you, Miranda.
Thank you. Good afternoon, everyone. So I'm just here to take you through the annual reports for the previous financial year. If you just bear with me for a minute, I'm going to share my screen. Can you see that?
Are you able to make it bigger at all, or is that all right? Yay, there we go.
Is that clear?
Yes, thank you very much.
Now, I can't see you while I have the screen up, so if it's all right with you, I'll present the reports and then welcome any questions that you have. So
we'll take questions at the end. Thanks,
lovely. Thank you very much for having me along to present the reports. We'll start with the adoption service. So many of you will know what the adoption service do. They recruit and assess all prospective adopters and provide ongoing support to adopted children. They provide therapeutic support and they provide more practical support such as contact with birth families. They provide reunification services for adults. The adoption process is quite in-depth and it's a two-stage process, and it requires candidates to be extremely searching about their backgrounds and their reasons for wanting to adopt children, and it takes between 6 and 12 months. We've got 5 teams. So we have a shared recruitment team with the fostering service, who last year managed 138 inquiries. We've got 2 assessment teams, and last year they completed assessments for 38 adopters. We have a family finding team, and they do matching from the earliest stages where we think a child may be adopted and there may be a plan of adoption, looking for families and looking to match children with the best families. And we have an adoption support team who provide therapeutic support. They also provide the more practical support with contact with birth families and the post-reunification support. They also access the Adoption Support Fund, which is a considerable fund available to local authorities currently for therapeutic services for children who've been adopted. So that's a little bit about the service. So in terms of performance over the last financial year, 36 children were placed for adoption. 44 adopters were approved. We often recruit more adopters than we need in Hertfordshire, and you're probably aware of this from previous annual reports. So what we do is we provide other local authorities with adopters, with Hertfordshire adopters for a fee. Last year, the court approved 45 adoption plans, and it's quite positive to note that we had an increase in early permanence placements or foster to adopt placements. So that's when a person is initially approved as a foster carer and they can take the child straight away, and then through the course of the court proceedings they are approved as an adopter. So it means the child only has one placement. It's much better for children, and we're really actively working to get as many early permanence foster to adopt placements as we can. So in terms of the National Adoption Scorecard, that's something reported nationally, and there's always a bit of a lag in the data reporting, but it shows an improving picture for us in terms of timeliness. And we are a leader amongst our regional partners in terms of how quickly we get children through the system and adopted at the end of care proceedings. There's also a little bit of information here about the Adoption Support Fund. So you can see quite a significant amount of money was received from the Adoption Support Fund, £626,000 for therapy for children who are adopted. Because a lot of children, you will know this, but a lot of children who are adopted experience a lot of trauma in the time leading up to their adoption and before with their birth families. So we've put a lot of emphasis on supporting them when they are adopted in their adopted family. So it's a lot of people sort of have the image that children are adopted and everyone goes off happily ever after, and that's the end of it, but it's very much not. And so we spend a lot of time working with sort of post-adoption support and supporting children to be in their families. And you'll see the information on the bottom of the screen there. We had one disruption. A disruption is very sadly when an adoption breaks down. We have very few. The year before we had no disruptions. It is very rare, but it is a terrible thing, and it's very, very sad when that happens. When we have a disruption, we have a very sort of thorough process in terms of reviewing everything that happened and learning from the disruption so that it doesn't happen again. So that's quite an in-depth process we go through. We had low numbers of complaints and sort of higher numbers of formal compliments and complaints, which is always a positive thing. One of the really exciting developments we've had in the past year is the Adoption Service launched the first adoption hub in the UK. So that was modelled on the Mockingbird model, which basically involves an experienced hub carer supporting a group of other adoption households, supporting them with support, advice, respite and overnight care and stays. So it's a really exciting development. We were thrilled to be the first to do it and to be able to and we wanted to build more of this model. And I'm going to talk a little bit more. We call them adoption hubs because Mockingbird is a particular model through the fostering network, so we're not allowed to call them Mockingbird adoption hubs. And I'm going to talk a little bit more about Mockingbird later on when I cover the fostering annual report. So over the past financial year, we've also continued to develop Adopt East, which is our regional adoption alliance. It formally went live a year ago. Hertfordshire generally, as I mentioned before, we generally over-recruit adopters. So we supply our adopters to partners in Adopt East and beyond. And that's now formalised in the alliance. We're also a bit of a leader in Adopt East in terms of our practice, in terms of the numbers of children we get through the system quickly, and in terms of the numbers of people that we approve as adopters. So we have spent some time this year supporting lesser performing local authorities, sharing our practice with them and helping them. And what we're doing in Adopt East at the moment is we are standardising practice across the alliance, and we are leading particularly in assessment work and looking to sort of standardise that and raise performance across the alliance. Special guardianship orders, you may know this, but just in case you don't, they're granted by the family court when an extended family member or a very close friend chooses to care for children on a permanent basis when their parents aren't able to. So our Family and Friends Service assess all the special guardians and provide follow-up support in relation to special guardians. And special guardianship has now been drawn much more into the adoption service, and special guardians can also access the Adoption Support Fund because it is another form of permanence. So it's been given a bit more recognition over the past year, which is a positive thing. We, in Hertfordshire, 22 special guardianship orders were granted over the past year, and we had 10 families who were able to access the Adoption Support Fund to get therapeutic support for children in their care. Of course, the last year has been fairly life-changing for us all with the COVID pandemic. Throughout COVID, there have been some delays through the family court, and you may well be aware of that. But in terms of the adoption service, assessments and matching progressed normally, and we actually approved more adopters than we had the previous financial year. We maintained face-to-face contact for all of our assessments of prospective adopters, and for a while the service were doing a lot of virtual work, but it's now 100% face-to-face again. We received additional funding through Adopt East from the Adoption Support Fund for therapy, because a lot of families, families with adopted children were no exception, really struggled during lockdown. So we were lucky to get some additional funding to support those families with sort of therapeutic provision. And we had throughout the pandemic, we had some really outstanding examples, really, of adopters and foster carers going above and beyond what they would usually do to settle children into adoptive placements or settle children in with their new families. So we had families, so usually when a child moves from a fostering to an adoptive placement, there's a series of meetings and it happens gradually. But with the pandemic, while we were in lockdown, we couldn't do that. So what our foster carers and adopters did was they self-isolated themselves in their own homes for a period of 2 weeks. They did a number of COVID tests, and the foster carers actually moved in with the adopters for 2 weeks to settle the children, which, you know, that involved a huge disruption for everybody's lives, but they did it, and they did it willingly for the children. So that was enormously positive, and we had quite a few cases where that happened. So in terms of sort of key objectives moving forward, Direct contact is something we really want to increase. So that is adopted children seeing their birth families, knowing who their birth families are, and having contact with them where that's appropriate. Because what the research tells us is this is what's best for children, and this is what's best to keep them stable and happy in their adoptive families. So we're really working hard on direct contact, which is a big cultural change for adopters. And a challenge for many of them. And it's also quite a cultural change for the service as well. So that's one of our key priorities. We want to increase our dual adopters. So those are the adopters who are initially approved as foster carers and then go on to adopt the children. Because again, that continuity of care, that only having one placement, settling children into their permanent home as quickly as possible is what is best for children, and we're wanting to do much more of that. Again, we have to keep the focus on timescales and the effects of we also need to look at the effects of COVID, because the post-adoption support work continues to be very demanding, and the demand continues to be high, which sort of mirrors work in other areas as well, as families are finding it, have found it difficult to cope. We want to build more hubs, so we're really excited to launch the first hub, but we really want to build more of this self-sustaining support, so adopters supporting adopters. And one of the other things we're really keen to do more of is encouraging prospective adopters at the very early stages when they're making inquiries to consider long-term fostering, because we always have more children in need of long-term fostering than adoption. So we're really wanting to see if we can get people thinking about the needs of children and thinking about what having a family might look like, and sort of branching away from their original thinking about adoption where that's appropriate. So that's a little bit of work that we're wanting to explore as well. And we also want to use the good practice in adoption to make sure that the offer across special guardianship and long-term fostering cases is as equitable and as strong as it can be, because we have some really good procedures and processes in adoption, and we want to make sure that children in those other types of arrangements, such as special guardianship and long-term fostering, have the same opportunities and support. So that's very briefly taking you through our adoption annual report. And now I'm going to move on to our fostering annual report.
Okay, so repetition. Miranda, can we just take questions on adoption first?
Of course.
Is that all right? Thank you. Not quite sure why I'm reverberating, but
it's because Miranda's mute. If Miranda mutes, you'll stop the echo.
It's okay. Oh yeah, that's it. Thank you. So Anthony first, please.
Thank you, Teresa. I'll try and be brief. I thank you for the presentation. I thought the report was very good. I thought the layout seemed to be an improvement. It was sharp and clear, and a lot of visuals, which I thought were really helpful. Just 3 quick points, a couple of questions. On the post-adoption support, I think we saw that little bit in one of your slides. Funding will continue on into 2021-22 when it is due to be reviewed by government. This is a recurrent concern, this sort of ad hocery. Can anybody cast any light on whether we have any form of longer commitment from government? Because post-adoption support, for all the reasons that Miranda outlined, is absolutely essential. Secondly, just in terms of online activity, and Miranda said a bit about this, so I don't need to repeat it. I am hoping to, as it were, recommence sitting as a independent member of the adoption panel, and it'll be interesting to see how that particular experience and that crucial set of meetings are undertaken, and what the ups and downs are of those now being more or less exclusively online. And my second question, first one was obviously post-adoption support. Second question on the courts, what is the experience? The report obviously goes up to the end of March, presumably this year. What is the experience over the last 6 months in terms of the, call it the efficiency of the courts But overall, very grateful for all the work that Miranda and her colleagues do within the adoption service.
Thanks, Anthony. And we're very pleased to be able to welcome you back to the adoption panel. So in terms of post-adoption support, I'm not able to shed any light at this point, but my colleagues may be able to.
I don't know if Marion's on the call and whether she's got anything. I do know that in the spending review, I think it was 7 million off the top of my head that was announced in relation to adoption services. However, we are not yet clear, to my mind anyway, on how we can access and what that's specifically targeted at, and probably more information will come out over the next couple of months. But it may well be that Marion's got further information, so I'll just open it up in case she's saying she hasn't. So I'm afraid. Sorry, I muted myself halfway through. We continue to watch that space, and we will keep you up to speed as we find out more information.
Okay.
Thank you, Jo. In terms of the question about the online, so Anthony, the adoption panel, it's really interesting. At first, people didn't like it online, but over the past sort of 8 months or so, it has become people's more preferred option of operating. I think what we need to do is probably look at it in more depth. I think fostering is a different kettle of fish, and I'll come on to that shortly. I think probably for the adoption panel, as soon as it's sort of safe and practical, we might want to do a hybrid approach, so a mixture of virtual and in person. But it certainly has had its advantages. It was a bit difficult at first. There's no two ways about it, as everyone was adjusting to the technology. But the feedback we're getting from adopters is they have preferred it. So I hope that answers that question. In terms of the courts, things have sped up again over the past 6 months or so. So when we went into the first lockdown, there was a slowdown, and then there was a bit of a lag. But adoption orders are now going through, and things are speeding up again. And I think the family courts have sort of adjusted to sort of new ways of working as well. I hope that answers your questions.
Yeah. Thank you, Miranda.
Thank you. If we could, Teresa, if we could be kept informed about the once they have more information about the CSR, because that's an acutely important part of the service. And I have to leave at 1, so my apologies, because I have another commitment.
Yeah, I'm hoping that we might finish this meeting by 1 o'clock. So indeed, we've all got other meetings to go to. Thank you, Nigel.
Yeah, thank you, Chair, and thanks to Miranda for a very good report. And I think we all have to acknowledge that obviously the pandemic and COVID has had a large effect over the last year on the adoption service, but you've obviously tried to cope as well as you could, with obviously some figures down. I just noted page 138 that during 2020-21, 7 children of the 35 placed for adoption were for Black and minority ethnic background, and I just wondered, is this better than the previous periods, and how does this compare to other comparative authorities? Also on the adoption hub, yeah, it's good to see the same principles with the Mockingbird again, and that you're trying to support that for fostering families, and obviously the 11 adoptive families in the hub, and obviously one would like to see that increased. And again, on the SGOs, clearly the figures going up. Are we, expecting the figures to go up again in the future? And I see you're trying to fully align that with, appealing to adopters, the SGOs. So I'm sure that will increase. And again, just to pay tribute to all the hard work that you and your staff have done. Thank you.
Thank you. In terms of your first question, it's on a par with the previous year, but it's something that we are focused on. In terms of the adoption hubs, absolutely, we think self-sustaining support, supporting adopters is the way forward. In terms of SGOs, they are going up. The Family Court are granting a lot more special guardianship orders, and although I don't have a crystal ball, I would predict that they will continue to go up. I can see Marion's got her hand up.
I just wanted to add very quickly, Nigel, that in terms of the Black and minority ethnic children, the critical figure is how many children are waiting rather than how many children are placed. Because if we took in a disproportionate number of Black babies, we would place a very high number of Black babies for adoption, but that wouldn't mean our practice was good. So at the moment, we don't have a disproportionate number of Black children waiting, and that's what we need to be clear about.
Thanks for that, and I understand better now. Thank you.
Okay, thank you. Thanks. So Paula. Paula, or have you frozen? Okay, let's go to Mark Watkin, then we'll come back to Paula. Thank you.
Thank you very much, Terry, and thank you again, Miranda, for all the work you and your team have done. And can I just say yet again, there's a theme running through, which is of creativity and looking at different ways of addressing issues that are challenging you. And I think your report about the COVID situation and how families adjusted to that and worked together was excellent, and the hub. But I just wanted to I just want to get one thing clear in my own mind, actually. SGOs, do we positively endeavour to establish SGOs, or are we in a sense reacting to a sort of legal situation where we're thinking we're going to go for adoption, but the courts sort of direct the family back to SGOs? It's just really about a question of approach from the very beginning. You know, when you're looking for children, do you first go through the SGO route, and when that doesn't necessarily develop what you would hope to have, which is a child back in its original family environment, in the wider sense, do you then go for adoption? And the other question I wanted to ask specifically about SGOs was, you talked about disruptive adoptions, which are, thank goodness, are very few. Is there any evidence about whether SGO placements are more or less disruptive than adoption?
Okay.
I can see Matt's got his hand
as well. Yeah, so I'm not sure who wants to answer that one. Matt?
Yeah, I can take the first part around whether it's the local authority care plan around SGO. And good practice in terms of court work is we sort of triple plan in the court. So we look at all family members that the family have put forward that wish to be assessed. But at the same time, we are sort of alerting our colleagues in adoption to the possibility that a care plan for the child could be adoption, whilst at the same time working with the birth parents about whether return home is successful or could be achieved. So we sort of have those triple plans in the court running at the same time. But certainly the practice in the service is very much around, you know, is there somebody within the family network? And if so, that's our option we'd want to consider under an SGO order. And we don't have a high percentage of our final care plans when they go into court being changed by the other parties. So normally the care plan that the local authority recommends is the one that the parties agree on, or the court make the final decision on.
Randa, have you got anything to add?
No, I would have just to echo what Matt said. It's always good practice to place with family, but just in terms of the answer to the second part of the question, Mark, what we see is that there in terms of breakdown, there are more SGO breakdowns than adoption breakdowns, but one would probably expect that given the work that goes into approving adopters. And, you know, that compared to sort of placements within families where they may not have set out, you know, originally to look after children, you might expect those outcomes. But I think what's positive is that SGOs are very much now coming into the adoption umbrella and sort of being looked at by adoptees and being supported, and those people can get adoption support funds, etc. So.
Yeah, so ultimately then that should hopefully prevent breakdown of SGOs.
That's right.
Thank you.
It's better for the child to be with their family. Yeah, okay. Thank you very much. Paula, are you back with us?
Yes, sorry, just the whole network collapsed and I'm
Can't hear you, Paula. Can't hear you.
Can you hear me?
Get closer to your mic. You've turned yourself off. Just about. Just
Sorry,
about.
I think my connection's really poor at the moment, which is why it dropped out. It was about the adoption process, which, you know, I think is one that can probably happen for our children. But one of the questions I did have, and great report and so many good things, you know, that we're the leader in getting them done months hopefully, and the hub dating on, and so that's some really good news. I just wondered how many families actually start out the process of adoption but don't finish. Do we have any big knowledge, but reports on that?
So sorry, Paula, you're dropping in and out, so we'll take that one question.
So yes, families do. There are, as you can see from the report, you know, when you look at the number of inquiries compared to how many people get approved, there is quite a dropout rate. So to sort of go back to the beginning of the report, really, adoption's a two-stage process. So there's an initial inquiry stage where a lot of basic checks and things are done, and that can often rule people out quite quickly. But then the longer stage, sort of assessment stage, that is really in depth. And people, you know, they're not, it's not just them that's explored, it's their wider families, their history, their family history. And so through that process, often it becomes apparent that people aren't suitable. And what we try to do is we try to counsel people through that, because as you can imagine, it's an incredibly emotional experience for people, and they're, you know, effectively for a lot of people, not making it through the adoption process means they're not going to have children, which is it's you know, a very, very difficult thing for people. So we try to take that to counsel people through and help people to sort of see that through the process of assessment.
Yeah.
So
Miranda, do you have numbers, those that apply, dropout number?
I don't off the top. I can send them to you. Yeah, we do keep all that.
I think that's what Paula was interesting. Okay, fine. Thank you very much. I'm going to try and move us on a little bit because I know we all want to get to lunch. So we're looking at the Adoption Service Annual Report. The recommendation is the Cabinet panel are asked to comment and note the Annual Adoption Report. Please, could you all support or not?
Chair, I'm not sure if I can get mine typed in, but I am supporting this.
Thank you.
Can you hear me?
Yeah, yes, I can. I'm having trouble too, so I think probably Teams is tired. Okay, I think we're done there. That's great, thank you. And now Miranda, fostering.
Right, I'll just share my screen again.
Yep.
Oh, can you see that?
We've got the adoption service. That's it.
Right. Okay, so now we'll come on to fostering, and I'll try to be quick because I know it's been a very long meeting for you. So this is a snapshot of our foster carers at the end of the financial year, and you'll see, I won't go through it all, you can see we had 612 foster carers, a very vast age group between 20 and 90, but the majority of our foster carers were in their 50s, and our longest serving foster carer had been with us for 39 years and 5 months, which is really an achievement. In terms of ethnicity and culture and nationality, the majority of our foster carers are white British, but we've got foster carers from a really diverse range of backgrounds. And we've also got, in terms of nationality, we've got foster carers from all over the world. This is a snapshot of our children looked after in Hertfordshire at the end of the financial year, and it will differ somewhat to what you heard from Lynn earlier in the meeting. You can see we had slightly more boys, and the majority age group was between 16 to 18 years. We had 368 children in our hut with our Hertfordshire foster carers, and we work every day to get our children placed in-house and not placed with independent fostering agencies. So in terms of the teams, I mentioned before we have the joint recruitment team, and last year they handled 246 inquiries, which was up on the previous year. We have 4 assessment teams, and they're geographically based in the north, south, east and west of the county. And last year they recruited 54 foster carers, and their role is to undertake all support, all assessments and to support foster carers. And then we have our ARC team, Attachment Regulation and Competency team, and they provide a range of therapeutic, supportive and educational and coaching services for the foster carers. So supporting them, particularly the foster carers, we're looking after children who are quite traumatised in challenging placements, so they provide a full range of support to those carers. We've talked a little bit about Mockingbird hubs. For anyone who's not familiar with a Mockingbird hub, it involves a specialist hub carer and a hub household that support a group of other fostering homes, and they provide advice, support, respite, sleepovers. It's a little bit like an extended family would, a bit like grandparents. This is, as I said before, in terms of the adoption hubs, it's self-sustaining support, and we want to keep expanding it. So we've been involved in Mockingbird since 2018, and we're continuing to grow it. We now have 5 hubs, and we're growing more. It's been very successful, and the people in the hubs really benefit from the support. It's really successful in keeping children with foster carers. You can see some quite nice quotes there from people who are part of Mockingbird hubs. So this year we formally relaunched our fostering strategy. So the previous year, our performance, or for a couple of years, our performance, it has mirrored nationally performance trends, but it hasn't been where we want it to be. So we've done an enormous amount of work over the past year relaunching the fostering strategy and reviewing everything we do. We've developed our marketing campaign more. We've got 2 communications officers helping us with that. We've reshaped our front door approach with a lot of help and support from the Behavioural Insights team. We've developed foster carers who are ambassadors to help us with our recruitment and help reach out and recruit more people. We've really sort of looked at our data and improved that. We've in terms of the service, we've applied a much more performance-based approach, which was perhaps not happening in previous years. And we've also streamlined everything we do so that it's as simple and straightforward as possible for our foster carers and our social workers. So I'm just talking about like the forms that they have to fill in, the assessments, the reviews, all that sort of thing. We've focused more on resignation, so when foster carers resigned, and we've put in place a really robust system to review the reasons for that and to learn from that, and to look at placement breakdowns as well, sort of reviewing and learning from those cases so that we don't make the same mistakes again. We've also, in all this work, we've involved foster carers, children, and our partners, both within Hertfordshire and our multi-agency partners outside of the council. We've had foster carers on all of our action groups working on the strategy, helping us to develop us, helping us to do the things that are going to recruit more of them and keep them with us. So you're probably thinking, what has that resulted in? So I'm pleased to let you know it's resulted in improved performance. Our inquiries have been up. So we had 246 as opposed to 195. We recruited 54 foster carers as opposed to 23 the year before. And our net gain of foster carers was 26 as opposed to -9 the year before. So we've over doubled the number of foster carers recruited. So this is all very positive, and it has resulted in us now being a bit of a leader in terms of our regional neighbours. So we've bucked the trend. The trend has been, our neighbours nationally and our sort of regional neighbours have struggled to recruit, particularly with the pandemic. But as a result of the fostering strategy and all the work, we have done really well. And we recently presented at a regional recruitment forum, sort of providing or sharing ideas about what we've done in our practice, which is really positive for Hertfordshire. So in terms of the performance, I won't go into all of this in detail. It was a good year. We turned the recruitment around and the deregistrations, but sadly at the moment our target, at the end of the financial year, our target growth still wasn't quite where we needed it to be, which does reflect the national trend. And so we just need to keep plugging on and keep the fostering strategy alive and keep it fresh and keep trying new things to keep recruiting carers and keep the carers we have, and also to place children in with the carers that we have. In terms of care leavers, we supported 79 care leavers to either stay with their family, foster families under stay and put arrangements, or live in supported lodging arrangements. Placement stability over the last financial year was good, and interestingly it was particularly good during the first COVID lockdown. And sibling placements, that was also quite strong, so we were able to place a sort of higher number of children with their siblings. In terms of COVID-19, so support groups have gone online, as has the fostering panel, but all assessments of, just like adoption, all assessments involving prospective foster carers were made face-to-face. We involved visits face-to-face. So nobody was approved without us going into their home and meeting them, even sort of through the lockdowns. And now all our work has, so during the sort of lockdowns, we were doing many visits online, but now all our work, 100% of visits is face-to-face again. Like I said before, we had some amazing examples of foster carers really going above and beyond, taking children with COVID, taking, just to really sort of stepping up during the COVID-19 period. And we operated a super carers scheme where carers willingly took children where there was a risk they may have COVID, or children who had COVID. Our foster carers were the first to be vaccinated, which was also really positive. But the legacy issue sort of going into this year that we're dealing with is we do have quite high vacancies, and we're doing an enormous amount of work at the moment to fill those vacancies. And what's happened is, a lot of foster carers have been sort of anxious about taking placements with the pandemic. So the recruitment and the retention's good, but now we really sort of have to focus on placing those children with the carers we have, and being realistic if carers aren't going to sort of move forward and take placements, really. So in terms of the key priorities, I've already said it. So vacancies is a really sort of key thing for us at the moment, increasing carer confidence post-COVID, well, as we move on through COVID. We need to keep our fostering strategy alive, and we need to keep it dynamic, and it needs to be responsive, and we need to sort of keep looking at what we're doing and whether it's getting the results we need. So we're reviewing it every 6 months, and that's really, really key, because I think in the past that hasn't always been rigorously reviewed regularly. We're reviewing our safeguarding practice with foster carers. There's certain things we have to do when we receive allegations, but we want to be able to do that in a way that supports them and doesn't alienate them and increases our retention. We want to sort of further develop our buddy scheme, as we have with our ambassador scheme. And we're also exploring, looking at sort of providing more respite offers for children on the edge of care, and looking at how we can step children down from residential care to fostering, so how we can skill foster carers up to have the confidence to take children who've been in residential placements who may have very complex needs. We want to keep growing Mockingbird, as covered earlier, and as I sort of said in terms of the adoption annual report, we really want to encourage more adoption inquiries, because we get a lot of those. We get lots and lots of adoption inquiries. We have to really work to get our fostering inquiries. So we want to see if if we can get some of people that initially are thinking about adoption, if we can get them interested in long-term fostering. So what I'm going to do now, I'm going to just try playing our latest ad to you, just to give you a flavour of things. If technology doesn't work for me, I'll move on. I've got something else to show you instead. So just bear with me and hopefully this will play.
There's no sound, Miranda.
I will move on. Right. So that's the end of my presentation. I'm sorry I couldn't get any sound there for the ad, but I can send you a link if you'd like to see that.
Yeah. I think if you send a link, and it's actually on Facebook as well. We've already spoken about that earlier. So thank you very much, Miranda. Colleagues, Nigel.
Thank you, Chair, and thanks for another good report, Miranda. And again, obviously, I understand the difficulties over during COVID, but interesting that the majority of foster carers are 51 to 60, so obviously we need to take that into account. And obviously, well done to the foster carer who did 39 years and 5 months service. But I think it's very good that your target, obviously, you've got the target foster carers. And you had to try and adapt in how you advertise and try to get interest, and the way you've had to do that. Again, obviously, page 180, the ARC reflective, the ARC program again, and developed by the Anna Freud Centre. And I note that team is working with CAM, so that's something to note, which is obviously good, and all those good reports about ARC. But I also know, very important to me, on page 184, the CHIC views, the Children Looked After views on how to be helped in communication when placements break down. And I think that's something we always need to remember, and especially when the voice of the child and the fact that CHIC have mentioned that. High number of foster carers over 70, so I understand that's how COVID affected them. So that's obviously we were hit there. The stay in put, the 64 now involved in stay in put, that's obviously important after that's come to us. And also, I think it's important to note the 7 cases that met the threshold for the ladder investigation. That we didn't have anything, as I say, too serious, but it's still always interesting to note when we see that. And just finally, are all the foster placements taken up?
They're not all taken up, and there are various reasons for that, and we monitor that really carefully. But as I sort of alluded to before in my presentation, that's our sort of key priority at the moment, is filling our vacancies. So at the moment we do have slightly higher vacancies, and a lot of that is down to COVID, and people they're either in a situation where they're in a high risk group, or they're anxious about COVID. So we're really working hard to sort of fill vacancies and to be realistic with carers. So if they're in a place where they don't think they're going to take children, to sort of move on, so that we don't have them there as a vacant carer, basically.
Okay.
Thank you.
Thank you.
Thank you. Fiona.
Yeah, thank you very much. Conscious of time, so I'll keep it brief. Thank you, Miranda, for another very comprehensive report. Yeah, first I'd like to acknowledge the amazing work carers do, our foster carers do, actually, and the impact, the positive impact on our children across Hertfordshire, because I can't imagine it is always easy. Although I can see from the comments, it is always rewarding, and support is obviously critical for foster carers. I just wonder, so a few questions. Is there a foster carer forum in terms of mutual peer-to-peer support? Because I could see how that would be really beneficial. I'm interested to know what percentage of children who are in foster care have additional needs. Apologies if I missed that in the report, but I didn't think I saw it. And then just picking up on the allegations, the quality of care concerns, the 7 cases. How easy is it for children to report if they have concerns? What is their mechanism? Do they have a key worker? As I'm new to this, I'm not familiar with the process. Thank you, Miranda.
Sure. In terms of support groups and forums, there's a range of groups. So we have cafe conversations, which are groups of foster carers that meet to talk about issues, needs, service development, etc. That feeds into a forum we have called the Fostering Forum, which Marion attends and Mark Mills-Bishop attends, and a lot of multi-agency colleagues attend, and I go and service go, and we hold that bi-monthly. So that's like a sort of feedback mechanism for them. They also have support groups locally. And there's a number of various support hubs as well. So we've got an under 7 hub, we've got a baby hub, we've got a teenagers hub. So we've got all sorts of support groups. And we also encourage foster carers to form their own support groups as well if they want to. And a lot of them are friends, they know each other. So they will sort of support each other as well. And then, of course, we've got Mockingbird, which is a little bit more sort of formalised, if you like, support as well. So we've got a range of peer support and forum activities. In terms of your question about the number of children with SEN placed with in-house foster carers, can I get that data to you? I have got it, but I haven't got it on the tips of my fingers. And in terms of your question about foster carers, so every foster carer has a supervising social worker, so they have their own specialist social worker who has to visit them a minimum of monthly, but often visits them more often than that, and is also involved in the child's looked after child review, and involved in all sort of key meetings and placement planning meetings, and supports them really, and monitors their training and development, assists them, with any worries they have. So they all have their own social worker, basically.
I'm sorry,
Marion wants to add to that.
Just picking
Sorry,
up.
can I just add that the child also has their own social worker. So the child social worker will always see the child on their own every time they visit. So if the child does have concerns, their social worker is always there for them.
Okay, thank you. Thank you for clarifying that, Marion.
And because the child social worker and the foster carer's supervising social worker work very closely together, as you can imagine.
We hope, yeah. Great, thank you. Mark, now I want to try and end this session.
I'll keep it brief, Terry.
Please, Mark.
Right, I'm just going to say thank you, Miranda, for another very good report. I have 2 questions which I wanted clarification on. You talk about training compliance remains a concern in your report. I didn't understand quite what that was about. Could you clarify briefly? And secondly, what was it about the Northern team that their review figures went through the floor and they were way below the rest and now seem to be catching up again? But otherwise, well done. I think it's the service is doing well, and I'm just going to compliment you on how you managed to recruit so many new foster carers. It is one other question I was going to put in. Sorry, how you've managed to cope with the demands, the additional needs demands that you're coming now with new children coming into care, and how's that putting pressure on existing foster carers who haven't been used to that before, probably.
Sure, all really good questions, Mark. So in terms of training compliance, there are some foster carers who do a really good job caring for children, and some of them have been caring for children for a long time, but we will sometimes struggle to get them to do training. So we're employing a range of things at the moment to encourage and support them to do their training, particularly their mandatory training, such as if you want to do more advanced training, you need to have done your mandatory training first, and also using the fostering panel a little bit to reinforce that. So I make a case goes to the fostering panel for a review regularly, or I should say, sorry, foster carers go to the fostering panel for initial approval and then for regular reviews. I make the final decision. If training's not happening as it should, I ask that it comes back to panel within a set amount of time, say 2 or 3 months, and training must be completed. So we're doing a number of things to encourage compliance and working really closely with our training and development colleagues on that one. In terms of now I've just
the North sector.
Oh yes, the North. Yes, unfortunately, the North had a dip in their performance. They had a change in management. I'm pleased to say their new manager is absolutely his things have really improved. It sort of came in with that focus on improving reviews. But I think it's you know, I think it's fair to say that in the past, probably a couple of years ago, probably the service weren't quite as focused on performance management as they are now. It's been an increased focus, and I think the sort of good old-fashioned performance management goes hand in hand with some of the more creative things we've done in the fostering strategy in terms of improving retention, and the additional demands at the moment. We are feeling it. We're trying at the moment to develop a 24/7 a bank of emergency carers that are skilled up to take very short-term emergency placements. We're working very hard with colleagues, but it's a perpetual balance of, you know, in the struggle to place children when there is high unprecedented demand, making sure we do put them with the right carers, because you know, it's no good. We may have people that have vacancies, but if it's not the right match, and the placement breaks down, it's really counterproductive and can be more damaging. So it's a sort of constant struggle at the moment.
Okay, thanks, Miranda. Thank you. Thank you, colleagues. Sorry we're having to rush through this one, but there was so much on the agenda today. Okay, so the recommendation we have is the panel are asked to note and comment on the annual fostering report. Please, could colleagues show their approval or not? So I'm in agreement, but little mauve boxes keep jumping up, so I can't write in my chat. So I approve as well. So,
Chair, I'm not sure if mine's gone in, but I approve.
It did. I was been watching them, but I can't get in. That's fine. That's all noted and done. Thank you very much. That brings us to the end of the meeting, but I just have one last announcement to make. There's no any other business, apart from the fact, if we could all come onto screen, please. If we could all put our cameras on. Miranda, if you could take that down. I think the Wi-Fi's playing against us today. Just to tell colleagues or remind colleagues that this is Matt Ansell's last Children Young People panel. Matt is moving on to, I think it's Surrey, isn't it, Matt? Yep. So, Matt, thank you so much for everything that you've done for the authority over the last, I think, 3 years. Really, really grateful. Made a really good headway, changed things around. We've seen some good stuff happen in our CLA areas, particularly and around safeguarding. So I'd like to thank you very, very much indeed for what you've achieved. And wish you well for the future. And just to let colleagues know, we have an interim assistant director taking Matt's place whilst we recruit, and that is Elle Mayhew, who's going to be joining us in December. Matt leaves tomorrow. So there we go. It's been a good meeting, and I just wanted to I was hoping you weren't going to leave, so I couldn't say that. So thank you so much, everybody. Our next meeting is on the 8th of February, miles away, and I think that's going to be looking at the IP. So about that time, isn't it? Seems about the right time. So again, thank you, Matt. Thank you, everybody, for your perseverance and brilliant input today. It's been really, really good. Thank you.
Thanks, Terry.
Bye-bye.
Cheers,
Bye.
Matt.
Bye. 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 Bye.